Welcome back, everybody. Welcome back to our afternoon section. My name is Benita. I'm one of the boss director of AIDS Concern Hong Kong. I'm an LGBT advocate and have been doing a lot of education work in the community in terms of Idaho or school outreach. Before we start, there's a few housekeeping items. For those of you who might need a translation in Chinese, there's a translation button at the bottom of your taskbar. You can choose whether to listen to this presentation in English or in Chinese. The second thing is we really want your input and your contribution. So there's a question and answer function in the chat. So if you have any question for Dong or Andrew, our next presenter, please leave it. We will have about 10 minutes for Q&A. So now, let me introduce Dong. Dong is the Executive Director of Lighthouse Social Enterprise in Vietnam. It is one of the first and largest MSM and LGBTQ community-led organization in Vietnam. He is a community expert and researcher in the fields related to the community, stigma and discrimination, sexuality, sexual health, and HIV prevention in Vietnam. His work ranges from designing and implementing various programs and innovation based on the MSM and LGBT community context and needs, conducting research to evidence-based intervention and efficacy. Dong has over 10 years of experience working with groups who are vulnerable and disadvantaged in the community in Vietnam. Currently, he's managing Bridging the Gap 2.0 programs in partnership with MSMGF and COC Netherlands and a research project named Action for Access. He is the country's focal point of two regional young networks, YouthLed and Youth Voices Count, which helps to raise the community voices. His own vision is a humanistic society where everyone can be healthy, equal, and happy. I think we have a lot to learn from Dong. So without further ado, Dong, please.
Thank you very much for introducing me and very beautiful words about myself and Lighthouse. And I'm very happy to be inviting to be here and share a little bit about my experiences working at Lighthouse as a social enterprise and also working with the key population and vulnerable groups in Vietnam. And today my speaks really focus on the social enterprise models, and it is a new way for the social and community organization to maintain and sustain the activities and create the greater impact to the community. So myself, Tom from Executive Director of Lighthouse Social Enterprise, and our mission, our vision is a future of better health, equal rights, and sustainable development for young key population and LGBTIQ community in Vietnam. And our missions and voices and improve the access and utilization to sexual and mental health care, mobilize an inclusive and cohesive community to ensure no one left behind. And one of our really focus in this year is build capacity and strengthen sustainability of the. And our focusing areas, the first is we promoting the sexual health and mental health among LGBTIQ and young key population. And we're also conducting community-based participatory action research and study to create the evidence for advocacy. And we also increase the advocacy for the rights of LGBTIQ and young key population and empowering and building capacity of the community. And lastly, strengthen the LGBTIQ and young key population movement in Vietnam. I would like to share with you, because we talk and today we talk about the sustainabilities and incomes and, to answer the question, like what is the right way for the CSO, the community organization to sustain and maintain the activities and continue working for the community, and look into the different sources of the different countries in Europe and Western countries. You can see in the first chart, you can see the overall proportion of earned voluntary and investment income in UK. So if you look into the blue line, so you can see that since 2003 and 2004, the income of the CSO in UK, it's from service return to the main resources of the CSO organization. It's accounting for 54%. So it means that they are switched from receiving the donor and the foreign aids to deliver the services and earn the money and earn the income from that services. And also in US, you can see in the table that incomes of the CSO in US in 2013. That's a very big part of the revenue from the service delivery and the income from the services. It's like almost 50%. And for social contracting, it means that the CSO, they contract with the government to implement the activities and also the social activities and projects. It's like 25% and 28% from other revenues, maybe from the donor and from the foreign aid or maybe from donation from the people and society. So we can see that the hybrid between the social impact and business is a new way for the CSO and community organization to think about the long-term and sustainabilities of the activities and also of the impact for the community. And in Vietnam, the social enterprise is a very new term, a new definition. We have from 2014, we have the updated law on enterprise, and we have the new term that's called social enterprise. So social enterprise under law in Vietnam is called for unregistered enterprise in accordance with the law on enterprise. And its operational objectives are aimed to solve the social and environmental problems for benefit of the community. And lastly, the social enterprise has to use at least 51% of the annual total profit of the business to reinvest to achieve the social and environmental goals as registered. Like how we register and we commit for the social impact to reduce the HIV new infections among LGBTIQ and young key population and remove the individual structural and community barriers to access with the health services and rights. So we have to commit with the government that we use at least 51% of our annual profits from the business to reinvest to achieve that commitment. So the nature of the social enterprise, the first is help to creating the social and environmental values for the community and society as the main goal. The second, business is the main mode of the operation. And last, the profits are not ultimate goals, and parts or full of the profits are used to reinvest in order to increase the social values. So here you can see that we have the two aspects to see and to look into the social enterprise. So the first aspect is social enterprise as an approach, and second, social enterprise as an entity. So the social enterprise approach, as known as the spirit of social entrepreneurship, is the application of innovative, market-oriented methods to solve the root cause of social and environmental problems, thereby creating systematic change and providing sustainable solutions. So social enterprise approach is a diverse combination of practice, tools, methods of the business sector with social sector to shape the solution to community problems to create the new social values and sustainable. But if we look into the social enterprise as an entity, so social enterprise are defined as a social-oriented business, maybe for-profits, maybe non-profit, or maybe hybrid model, creates to solve social problems or market failures through the private sector business approach to improve the efficiency and sustainability, while at the same time creating the benefit or social change. So depending on the context of each country, social enterprise can operate under the different legal forms. For some countries, it can consider as a non-governmental organization or charities or cooperatives or private enterprise. And advantage of the social enterprise approach, I think there are three advantages of the social enterprise approach. The first is the social impact. Second is increasing the financial autonomy. And lastly, efficiency in the organization. So increase the financial autonomy. It means that we're operating in the way of business, helps the social enterprises create a flexible sources of capital. We used to call it unrestricted income. It's not limited to the purpose of the use and time to use. It helps social enterprise to be more autonomous in their goals, values, and how to implement their initiatives. In terms of the sustainability, CSO programs or projects may have limited implementation times, limited donor resources, and sometimes it will be donor driven. But meanwhile, the social enterprise carry out social mission through the business activities. It will not, with no limitations of the implementation times and resources from donor or sponsor. And therefore, social enterprise have many conditions to create the sustainable social impacts and replicate the models to create impact on large scale. And lastly, efficiency in the organization. So in applying the business principle to help the social enterprise to take advantage of good governance experience from the business sector to operate effectively and entrepreneurial spirit influence into the social enterprise. It will have motivate the employee to operate and to know how to optimize resources to achieve the high efficiency. So now go back to the how we has switched the models from 2004 until now. So in 2004, we established as an self-help groups. We call Lighthouse Club 15 years ago, more than 15 years ago. And in 2016, actually in 2014, we start the first business with condom and lubricants to sell the condom and lubricant to the community. And in 2016, we officially registered as a social enterprise with the Vietnamese government, and we call Lighthouse Social Enterprise. And now, until now, we have the 16 years anniversary, and we have more 5 years, applying the hybrid models in social activities and business. And this is a very simple, progress from a CBO to a social enterprise with Lighthouse cases. In 2004, like I introduced with you, we are a groups of young MSM and transgender community to communicate and educate on HIV and rights. And in 2017, we start to design the social projects and applying for different funders, and we funded by the international donors. And 100% of our incomes depends on international donor. And in 2015, we start to provide the services and products to the community with fee-based and free service and products. So for the services, we focus on the HIV lay testing and HIV referral to HIV treatment. And we sell the quality condom and lubricant to the MSM and trans and LGBTIQ community. And we start our small business from this year. And in 2016, we decided to register with the government as a social enterprise. So we provide the multiple projects and multiple services for different, not only community, but also our partners and also other company and private sectors. So the first we design, we still keep to designing and implementing social and community projects. We continue our very first business that's selling condom, lubricants, and other products for the LGBTIQ community. We also just operate and open the one-stop shop LGBTIQ clinic to provide the comprehensive sexual health and reproductive health for LGBTIQ community in Hanoi in this year. And lastly, we provide different technical assistance, trainings, and also entertainment services for other NGO company and other, even the CBO and also government and private sector as a service vendor. So here is some example. I have no time to prepare a very complex and a lot of pictures with you, but this is because we found that there are some projects that provide the free condom and lubricants, but community need more than that. They need different kinds of the condom and lubricants. They need more qualities. They need the diverse and like a lot of kinds of the condom and lubricants. So we're trying to working with different manufacturers and also working with some projects who support for the social enterprise to connect for the private sector and manufacturers to working with them, and we buy the condom and lubricant from them and then sell it for the community. And we also provide the fee-based PrEP and PEP. It's really important for the community because now we have PrEP, but it's not covered in whole province in Vietnam. So there are a lot of the province, they still need PrEP and PrEP and PEP as well. And for PEP, it's also really important for the community to access to PEP because it helps them to prevent the HIV and reduce the risk with HIV after they got, exposed with HIV. So we not only sell it in our office, but we use online channels. We use a community online channels like Facebook, Instagram, TikTok, and also other community channels to promote for our products and also introduce the product to the community. We also organize and also participate in different community events, and we also promote the products in those events together with very positive message to the community, like using condoms can help you to protect and proactive protect yourself, or my health, my choice, or live morally without fear, and you can protect yourself. I mean, like, profit is not our main goals, but we're trying to get community responsibility for their health. They have to pay for the quality product and services, and it means that they're more proactive and confident in protect themselves. So, I mean, combine between the products with the positive message and sales with the community is really important. And PEP and PrEP also, we run a different social media campaign to promote for PrEP and PEP and make sure that community, they can access, but they can fully understand about how PEP and PrEP can protect themselves. And Lighthouse One-Stop Shop Clinic, we are working with US CDCs in Vietnam and also the government to implement one-stop shop models. It means that we not only focus on HIV services, but we're trying to address the different needs of the community in terms of services. Like for some people who comes for HIV testing and treatment, but they also face with some mental health problems. So we're trying to provide the mental health counseling and also working with psychologists to refer the clients to receive the services. And as you know, that ChemSec is really popular in most of the country right now at the moment. And many of them also face with different problems with the harms, and they cannot access to harm reduction. So in our clinic, we also provide different kind of services. So we really focus on HIV services, HIV testing, counseling, treatment, PEP and PrEP, but we also provide different kinds of other services like mental health counseling and mental health treatment. We have STI testing and treatment. We have the PEP and PrEP. We also have the different kinds of the testing, like for transgender people, we also provide the hormone testing for them. And our doctor will provide the counseling on the hormone therapy and how they can, when they are ready for surgery and hormone therapy. So it is a combination of different and very wide range of the services provided to the community. For some services we cannot provide, so we trying to put us in the middle. So we will connect the client to other friendly and quality services, and make sure that they can receive the service. And sometimes from the third party, the third service vendor, they also give us some money of referral system. We also provide other services as well, like I introduced in the beginning of my presentation. So we provide the technical assistance. As you know, that Lighthouse established in 2004, and so far we have more than 15 years with a lot of expertise in community projects and community programs. So we provide the technical assistance services for multiple NGOs and also other CBO as well. It really depends. We not charge them in the full, in the same rate. It really depends on CBO. Sometimes we provide the technical assistance for free. For NGO, it really depends on the projects. They can provide some income for the organization. We also provide the entertainment services. As you know, for the HIV sector, for HIV field, there are a lot of the projects, and they do a lot of activity in terms of the behavior change communication, community events, or maybe like social media campaigns. So we consider that we have a lot of expertise on that area. So we're trying to promote our expertise to different projects, not only on HIV, but also on like gender equalities, or maybe on like environment projects, about like how can we organize the community events, how can we help them to run some social media campaigns, and they can pay us for service, and we will provide that kind of services for them. I think that this is really potential, and we also collaborate with one or two private companies to run their own campaign for the community. Because as you know, the private sector in private company, they have the fund for the social, to create the social impact, and they also need some other kind of social enterprise to help them to shape and design the fund and the programs or events to meet the need of community, and also to make sure that is relevant to the community. So we have those expertise. And lastly, provide the training. And now we have a lot of campaigns in Vietnam asking for the gender equalities, asking for the equities and equals opportunities for the vulnerable groups like LGBTIQ community, like the HIV, the people living with HIV or affected by HIV. And then the company, they have the needs and demands to train their staff how to communicate with the vulnerable groups, and also to working with some community like LGBTIQ people. And then we provide them the trainings on SOTIs, on gender diversities, on how can they understand the needs and issues of the LGBTIQ community, and how can they provide the friendly and appropriate services for those people. We're also working with some private hospital and clinic, because there are lots of the data showing that the stigma and discrimination in the healthcare setting has caused a lot of barriers for the community to access the services. And if they want to increase the number of the clients to their clinic, they need to train the staffs. They need to redecorate. They need to build the SOP, and they need to develop the code of conduct for their staff. So we provide those kind of services for them to help them to build the friendlier environment for the vulnerable groups. Of course, we are developing our models, and we just start operating our clinic. We of course still face with a lot of the challenge and difficulties in our operation. Like in Vietnam, for now, the law and policy, there are no specific law for social enterprise. So we are very confused in some articles in the law on enterprise. It mentions about social enterprise. And we also have no support from the government as a social enterprise, like reduce the tax, or in some good program to promote for social enterprise. We don't have that now. So I think for the next step, we need to advocate for a very specific enterprise law and policy, and make sure that the government, they support for the models of the business, but it's combined with social impact. Is very important for the society. And it can address the concern about the sustainability of the current projects when the donor live out of the countries. How can we sustain the impact that we are and the efforts that we are working on? And in terms of a CBO, we also need the capital, but the social enterprise is not really familiar with some I can say mainstream business, and we need to promote for these models more and more, and get people knows about it, and get more support from the business sector to social enterprise. And I know that there are a lot of CBO, a lot of community organization. They are think about, and they are also learns on how they can open a business and can start a business or register as an enterprise. But there are very few information, so we need to provide more information to CBO organization, and also building their capacity to make sure that they can have a very strong capacity before that they start the business, and reduce the failures of the models. So I will end my presentation here, and I'm very open for any questions or any clarification for Lighthouse. And thank you once again. Thank you so much for inviting me to this very interesting section. And thank you so much for listening.
Thank you, Dong. It's very insightful to hear how you share your social enterprise experience in Vietnam. And we already received some questions, so we'll get back to the Q&A after Andrew has presented. So our next speaker is Andrew from AIDS Concern Hong Kong. I think everybody here know him. He's the spirit of this organization. And also, I think he will be sharing some exciting thing about my place, about the social enterprise that AIDS Concern is now developing. So now, go for you, Andrew.
Okay. So hello, everybody. I'm really pleased to be able to present today about the role of NGOs in social enterprise. So I think someone needs to help me with the screen and the presentation. because it's not coming up. So okay, I think we're there. Good. Can you see it, Benita? Yeah, okay, good. So I'm really pleased to talk today about how non-government organizations like AIDS Concern can help to end HIV by 2030 using a social enterprise approach. We're living in a modern age, and it's really important that the HIV prevention work that we do works for people so that it reflects the interactive and digital lives that they have. So I'm going to talk today a bit about how NGOs can help to support ending HIV with this aim in mind. So what is this that you can see on the screen? What's this picture? Is it cod liver oil? It looks like little capsules of cod liver oil that you might take to improve your health, doesn't it? No, it's not. It's actually a sexual lubricant. So this is a lubricant in capsule form. You push one up your anus or up your vagina before sex, and it helps lubricate you so that you can have pleasurable sex that is also healthy sex. It's really important, of course, in terms of anal sex that people are well lubricated so that we reduce the risk of any damage or infection. So this is a product that AIDS Concern is now selling that people can get from our website. This is an HIV self-testing kit vending machine. So we've just launched this. HIV self-testing is starting to become available all over the world, but we're trying to push its distribution hard in Hong Kong to make it accessible to people. So this is a vending machine where you can buy a self-testing kit. This is a PrEP medical checkup service. So at the moment in Hong Kong, PrEP is using HIV medication to prevent HIV, which is now proven to be very effective if people do it properly. So what we're doing here is providing a medical checkup service for people who want to get on PrEP. Now, the government and Gilead, the company that produces Truvada, the medication, have not yet come to an agreement in Hong Kong about how to make PrEP available through the public health system. So while they work out how to do that, it's important we give the community information and support so that those who are accessing it from outside Hong Kong can do so safely. So these are all examples of how we can act in a modern, dynamic way to give the community access to things that they need and they want. I'm going to talk then about three things in my presentation. Firstly, I'm going to explain a little bit more about ending HIV and comment on whether ending HIV by 2030 is actually possible. I'm going to talk about what the opportunities are in the HIV response in Hong Kong in particular, and then I'm going to come on to what. Just imagine if we could end new infections of HIV, how enormously important that would be for people whose lives are currently affected and might be in the future. We can see from the UNAIDS data that millions and millions of people have been infected since the start of the epidemic. And tragically, 33 million people have died from HIV/AIDS. Now in Hong Kong, we can see that there have been over 10,000 new infections since the start of the epidemic. And also we see 565 people diagnosed in 2019. So we've got a lot of work to do. Here's the reminder of the Hong Kong data. So this is new cases of HIV per year. And we can see that we had a big rise until 2015, where we saw 725 new infections that year. Since then, we've seen a drop of just over 20%. So that's good progress. And I'd like to congratulate all of the people working in the community and the community itself, and all of the HIV workers and volunteers who are helping to make this happen. So that's good progress, but we've still got a lot to do. There's still far too many people being infected. So at the moment, we can estimate that there are probably about 8,000 people living with HIV in Hong Kong today. So that's a lot of people and a lot of impact in terms of their health for them, but also in terms of the medical and support services that need to be available for them. So I want to really point out the urgency of the situation. If we continue at the same infection rates for the coming years, within 15 years, we will see double the number of people living with HIV in Hong Kong. So if we see 565 more new infections each year, this is what we will get to. That's a very large number of people for a city this size. So Asia World Arena in Hong Kong has a capacity of 16,000 people. If we don't stop all of these new infections, we would be able to fill that arena with people living with HIV in Hong Kong. Now that's bad in terms of their health and the impact for their lives. It's also very bad for the health system, which has to provide medical treatment and support for all of those 16,000 people. So let's make sure that doesn't happen. In Hong Kong, like a lot of other world cities, we see that infections among gay and bisexual men and transgender people are where the majority of the cases are happening. So over 70% of cases are among this group. So in the HIV community, of course, we talk about men who have sex with men, MSM. So this is the group where we need to put a lot of focus. But I want to show how other places are managing to get big cuts in the number of new cases of HIV, because I think this shows us that it's possible, and we can also learn from these other places. So San Francisco has had an MSM epidemic for decades, but you can see that back in 2006, they had 540 new HIV cases. That's the yellow line. Last year, they got down to just under 170 new infections. So that's a drop of over 80% within 15 years. So this is big progress, and I think we can look to learn from them about what they're doing. Here's what's happening with cases in the UK, which also has an MSM HIV epidemic. So you can see that among gay and bisexual men, there's been a major drop in new HIV infections. If you look at the data back to 2014, you can see that actually the number of cases among MSM has dropped by nearly half, so 46%. So this is very big progress. Where are the Hong Kong gaps in our HIV response? Well, I think we can look at what's being achieved and what more do we need to do. We need to continue working to let the community know about the risk of HIV, to keep using condoms and whatever method of prevention works for them. I think Hong Kong is actually doing really well on getting people with HIV onto treatment and getting them to undetectable viral load so they can't pass HIV on to other people. I think where we've got some gap is on diagnosis. So this morning, Dr. Bonnie from the Department of Health was talking about the fact that there are probably 1,500 people living with HIV in Hong Kong who do not know that they have HIV yet. So this is part of the gap, and the new infections will come from those people. So this is part of the work that we've got to do. So in particular, we need to get the testing rate higher in Hong Kong. At the moment, only 52.6% of MSM have tested for HIV in the last year. That's according to the Department of Health PRISM survey data 2017. The other thing we need to do is introduce pre-exposure prophylaxis, PrEP, to the public health system. I think without doing these two things, it's going to be very tough to get the numbers down as quickly as we want to. So we need to raise the HIV testing rate, and we need to introduce PrEP. Here's what's happening in Sydney, another city with historically with high rates of MSM HIV infections. This is data from the Sydney Gay Community Survey, which is showing how often do people test for HIV among this group. Now, what you can see is that actually the rate of testing is is quite high now. So the blue line is lifetime testing. Have you ever tested in your lifetime? This is among gay men in Sydney. The red line is have you tested in the last 12 months? Now, what you can see is that over 3/4 of Sydney gay men have actually done an HIV test in the last 12 months. Now, compare that to Hong Kong, where we're more like 50 to 55%. You can see this is where we need to do some work, because testing means we identify people, we get them onto treatment, and we prevent further infections. There's a paper being studied by the University of New South Wales back in March, which was looking at the frequency of testing among gay and bisexual men. And what they found is that there's a strong correlation between people who test often and people who are using PrEP. Now, this is to be expected, because to get PrEP access, you need to have testing. But what it means is that PrEP access has actually been a key factor in driving up the rate of testing among high-risk people. So probably on average, people on PrEP in Australia are going for testing at least 3 times a year. So I think this is what shows that we need to have testing, and we also need to have PrEP. I'm just going to quickly mention 56 Dean Street, which is a pioneering HIV diagnosis and treatment centre in London, in Soho district. Now, they've been doing a lot of work, and we've talked to them to say, what is it we need to do to get the testing rate up? And they have said, apart from promoting testing, the key thing they've seen is that you need to have many different routes to testing for people to make it really easy and accessible. So, of course, we have centre-based testing at clinics in Hong Kong. We have venue-based testing in bars and saunas, but self-testing is not rolled out enough, and self-sampling, where people take their own body samples and send them to a lab, is another option. What they also do is they risk assess the clients, the community members who come for testing. And for the people who have very high risk for HIV, they advise them to come more frequently. So, you know, if you have multiple risk factors, then you should be coming more often. They give them reminders, and they offer priority access as well to the service. So, testing. I'm not going to talk much about PrEP, because we've had a lot of information already at this conference about PrEP. But I'm just going to mention that I think we have lots of international data showing PrEP is very effective. I think we now have local data showing that it can work for local population as well. The NGOs like AIDS Concern are doing education and support work, as well as medical checkups. We now need to get PrEP introduced urgently into the public health system. One of the suggestions I would make is that we can look at how social hygiene clinics and NGOs can provide some of the infrastructure here to do the medical checkup service and connection to medication. So these two big issues, testing and also PrEP, but I think we need to be looking at what role can NGOs be playing in the HIV response. And I would say that we know HIV is a very stigmatized medical condition, very taboo in Hong Kong and many other places. I think this is one of the reasons why non-government organizations can be really important, because often people are more comfortable to come to non-government organizations about some of these stigmatized issues. And NGOs are connected into the community. We can often bring in innovation faster than government and others can. But, you know, we're working in a really tough financial environment. It's difficult to get grant funders to give money for HIV services. And it's also difficult to get the public to donate. So what we must do is look at using social enterprise approaches where we sell products and services. What is social enterprise? Well, Dong in the last presentation has given a really good explanation, so I'm not going to dwell on this. But it's to say that NGOs which traditionally seek money from grants, donations, or endowments also begin to sell products and services with the aim to bring in income to cover the costs of services. So this is what we're working on. I'm going to explain what AIDS Concern has been doing in the last couple of years. So we've launched a social enterprise project called My Place by AIDS Concern. so people can pay for products and services. AIDS Concern is going to continue offering free education, testing and support services to the community, but by also offering some paid for products and services, we can give the community more choice, and we can also help to cover the costs of these things. So the income covers the costs. If in time, if the services and the products grow in terms of the amount that we're able to sell, we can start to offer more subsidized services for people and free services to people who aren't able to buy them. So here it is, My Place by AIDS Concern, launched in, well, we actually launched it in 2019, but it's really gearing up now in 2020. So, you know, we've got these 6 different projects. My self-test, HIV self-tests, My PrEP checkup. This is about medical support checks and prescription for people who want to get on PrEP. My Checkup, this is a sexual health checkup service. My Pleasure, selling condoms, lubes and sex toys. My Coach, sexuality and sexual health counselling. And My Life Skills is sexuality education. So my self-test, we've got the World Health Organization recommending very strongly that self-test is made part of the choice that's available for people. But it's really important we give people choice of good quality self-test kits. So the Department of Health has a list which refers to the USAID list of self-tests, which are good quality. And AIDS Concern has made 2 of these tests available. So we've got the Bioshock fingerprint test and the AuraQuick mouth swab. We've signed an agreement with Bioshock, so it's their product, to be the Hong Kong and Macau distributor for the Bioshock self-test. So that means that we sell it ourselves, but also other people who want to sell it, buy it from AIDS Concern, and then they can sell it as a retailer as well. We've got a partnership with Watson's Pharmacy. So the Bioshock fingerprint test is now in 150 Watson stores and also online. It doesn't make any charity profit at the moment. The volume is is not high enough, and the margins are also not very significant. When you bear in mind that you have to pay for the cost of the kit, the staffing to operate the service, and also the promotion to get the community understanding it. But it's a social enterprise, so we're excited that we're opening up access to HIV self-testing. We've sold 3,000 so far. We're going to be putting out vending machines across Hong Kong. We've started with 3, so they'll be placed in gay venues and other public spaces. My Checkup is an STI checkup service. So we get a lot of feedback from community members that they often don't like going to some of the other services that are available for STI checkups. So this is an alternative to going to a social hygiene clinic or a private clinic. It offers a wider range of STI testing than AIDS Concern does through our HIV testing, and it has LGBT-friendly doctor consultation. So we've set up these different plans that people can purchase from My Place, A, B, and C, different STI checkups in there. What happens is people visit to give samples of blood and urine, for example. They return for the lab tests and results and a doctor consultation, and then they receive referral and treatment. Finally, My Pleasure. Look, people are able to explore their sexuality and sexual pleasure now at the click of a button. So, you know, people are seeking pleasure, intimacy, and connection. And it's really important that sexual educators are working to recognize pleasure and sexual health together. I think we need to stop just saying sexual health is what you need. I think we need to explain that sexual pleasure is important to people, and here is how they can find pleasure healthily and safely. So condoms, lube, and sex toys, you can see some of the products here that we're stocking. So the product range is emphasizing pleasure and innovation as well as sexual health. The next steps for us, I think, on social enterprise is that we need to educate the community and promote these service options. We need to look at the demand, reach, impact, sustainability to work out how do we grow it. I think we can look in the future at things like introducing a rainbow doctor general medical service for LGBT people. And I think we can also look at the option of introducing HIV and other self-sampling products for people where they take their own samples and send them to a lab. So my conclusion is, I think we can have a big drop in new HIV infections. It does require focus on some key things like testing and introducing PrEP. And I think NGOs can have a key part to play in cutting the number of new infections using a social enterprise approach. Thank you very much for your time.
Thank you, Andrew. And now I think Dong is still with us. So I have questions for both of you. So Dong first. So first question for you, we got it from the audience. The easy one is, how many people have benefited from the Lighthouse enterprise in the past? And the second question will be, how do you think you can be competitive in the market, given there are other large business company who might offer similar service? So how do you position your service in the community? So two questions, Dong, go first.
Yeah, for the first question, because we established in 2004, and so far it's quite a long time providing the services, educate community, make sure that community have better knowledge and understanding on HIV and also other sexual health information. So far we providing services for the community for over 10,000 MSM and trans community in Hanoi. And in our social media channels and also other communication channel, we have more than 50,000 people who are following us and who are receiving the information through our channels. So we also count them as, benefit from our activities.
Thank you. Second question.
For second question, when putting us into the business, we also consider there are lots of challenge and a lot of competition with other private companies and also other service providers. But we identify the, our own values and our own, unique points to the community. So all of our staff is LGBTIQ community. So we provide the friendly and understanding and, enthusiasm services for the community. That is the first unique point of the Lighthouse service. And second, we provide the wide range and, the needs-based service for the community, because we are the insider of the community. So we have the opportunity to listen to the community and also knows about and collect the opinions from the community about the needs and about what they like about the services and products. So from that, we can very quick to adapt our services and products to meet the need of community. And lastly, because we have the really good network with the community members in Vietnam and also in the Pacific region. So it's very easy for us to, joining in the community channels and providing the information and introduce the services for them. And like Andrews also mentions about, how can we use that kind of advantage to create the social change and to make sure that community can increase the access to the services and products to make sure that we can eliminate HIV in the future, in the near future. So we always be considered as a social business. It means that community also consider us like some, an entity to create the social impact to the community. So I think that is the some strengths that we have at the moment to, provide the services community and compete to other service provider to the private sector.
Thank you, Dong. That was very insightful. So now I'll ask Andrew. So Andrew, you mentioned a variety of service that my place provided, whether it's self-test and my pleasure. So I know in Hong Kong, using a social enterprise model to talk about sexual health is still quite new. So how are you going to market and position yourself so people will, you can attract the people who will need this service?
Well, I would say I was really pleased to hear more about the work that Tung and Social Enterprise are doing. We've been inspired by the social enterprise work that they've been doing, and that Vietnam has been very forward-looking in doing. Actually, I think they're one of the countries in the region that's doing a lot on social enterprise. But I think what we can see is that in Hong Kong, you don't have a legal framework for social enterprise. So you don't register, you don't need to register as a social enterprise. So AIDS Concern is using a social enterprise approach in some of the things that we are doing. So we continue to offer, as I was explaining, free services for the community as we always have, but we're now introducing some other products and services so that people can have the choice. I think it does risk leading to some confusion in the community about, what is this organization? Does it just offer free stuff, or is it going to charge me? And I think care is needed to make sure that we don't put people off coming to use our services because they think it's just a business that's going to charge them. So I think it's really important that we explain very clearly what is AIDS Concern, and that my place is related to AIDS Concern. So you'll see when I put up a presentation that the logo for my place says in big letters, my place, and then in small letters it says by AIDS Concern. So we're wanting to make sure that people know there's a clear link between the two, but we're working to educate people about that. I think we need to make sure that the community understands what the key features of these services are that they will like. That means that they will want to buy the products and services. So I think, for example, if you look at My Pleasure, we're at the moment, we've just set up an e-commerce site, which is selling some condoms and lubes, so which is what Lighthouse has been starting to do as well. And what we're trying to do is select products that aren't just the regular products that you find on every supermarket shelf. So products that are particularly interesting or innovative or sexy, that really speak to the community that we're working with. So, we're not stocking some of the general household condom items or lubricants. We've really been looking at what are the products that the community wants. So I think this is part of what we can do.
Thank you, Andrew. And I myself run a social enterprise, and I know in Hong Kong, sometimes people get confusion with that concept. So I agree with you. It's important to get the marketing right, so people get have the correct expectation when they're using your service, whether it's AIDS Concern or My Place. So we are a bit running out of time. So I think we'll close this section. So thank you, Dong, and thank you, Andrew, for being with us and share with you your experience in how social enterprise can help and HIV in Vietnam or in Hong Kong. So now it will be our next section, and I'll pass the time to Andrew. Thank you.
Thank you, Benita, and thank you, Dong, as well, for that really interesting session. So I'm now going to introduce the next session this afternoon. So it's the 30th anniversary of AIDS Concern this year, and we really wanted to invite someone to talk to us about progress that we've seen on HIV and make some observations from a different viewpoint about what we need to do next. So I'm really pleased to be able to introduce Mr. James Chao, who is an international broadcaster who many people will know from his work in hosting a whole variety of programs around the world, but also particularly for his experience in interviewing numerous international figures, many of them highly influential and powerful people. James himself was formerly serving as a UNAIDS Goodwill Ambassador. So he's taken a personal interest in HIV. And in 2016, he was appointed as World Health Organization Goodwill Ambassador for Sustainable Development Goals and Health. James is also now running the China Current, which is a digital storytelling experience. So maybe in our conversation, we can hear a bit more about that later. So James, I'm really, really pleased to welcome you. And can I see? I can't see him right now. Is he there?
I'm here.
Oh, you're there. There you are. Your picture just popped up. It was a bit missing. Welcome. It's really nice to see you.
Thank you so much, Andrew. And first of all, happy birthday to AIDS Concern. You have toiled and persevered and pushed forward the front lines for our AIDS community, not only here in Hong Kong, but right around the Asia Pacific, which is really important to each and every one of us. So happy birthday, and of course, always an honor of the more than 30 million people who didn't make it this far.
Yeah, so 33 million people estimated to have died around the world. It's a shocking number, a real tragedy for all those people and their families. And what a loss, what a missed opportunity with those lives. I think a lot of us reflect in this type of way when it's coming up to World AIDS Day, which is in a couple of weeks' time. And I think it's a good opportunity to remember all those people and also to talk about what we need to do for the future. So James, you've been connected with the HIV world for quite a long time in the work that you've been doing. I wanted to ask you how you became interested in working in HIV in particular.
Well, Andrew is very different. I think the story in itself was, a great blessing on my life. Many years ago, I was working in Beijing at that time. I was a news anchor on television, and I thought to myself, as much of a privilege that job was, I wanted my life to count for something much more. And through a series of conversations, I got to meet Peter Piot, who, of course, at the time was the founding executive director of UNAIDS. I had no idea at that time what executive director was or knew very much about what UNAIDS was and its mission. And he brought me to California to be part of a group of young leaders who in some shape or form were connected to the AIDS movement or could be connected to it. And it was so interesting because they came from so many different facets of society, be it domestic violence or through science or through communications like myself. And it just goes to show, Andrew, how important it is that we look at AIDS not only as a health emergency, because it always will be an emergency so long as one person is getting infected in the world, but also how we need to look at it as a complete picture. And I'll come back to that later, the relevance of what it has on our landscape today with COVID-19. But of course, AIDS, when you think about it, of course, there's the health, there's the science, there's the law enforcement, there's the community advocacy, there's the civil society, there's the political leadership, there's the LGBT plus community, and so much more. And of course, women and girls in that, mothers, maternal child healthcare. So in a way, it opened up my life to the world. It's funny because, by that time, I was already an experienced television broadcaster who, as you very graciously said, have had the honor of interviewing so many people who shape our world and who have misshaped our world. But I think it was only through AIDS that I understood the connection between human rights and the world and why it matters to each and every one of us.
So you've moved in circles of people, many people working on HIV, and have been helping yourself to educate the world about it. So I noticed that you've hosted many different sessions at things like the International AIDS Conference. So you know a bit about the picture around the world on HIV. So I wanted to ask you, do you think that we're winning this battle against HIV?
Yes and no. And I'll say no why, because I think it's so easy to get carried away with a positive message about AIDS when too many people are getting infected every day. I mean, in this day and age when we do have treatment and when we have different front lines of treatment available, on paper at least, to all of us, you ask yourself, why don't enough of us know our status? Why can't people get tested? Why aren't people getting tested? Once they're getting tested, are they getting onto the treatment programs that are effective for them? And are they able to see that through as well? So it's, I think it's still a huge stain on us as humanity that we got the initial steps wrong in the global AIDS response, particularly at a political level. But of course, everything has changed today. You know, you just speak to anybody, and why Peter took us to California at that time was for us to pay respect and to understand the history of AIDS. Now, it's not confined to California, but that's where some of the first identified cases were made in June 1981 in California and also in New York. So it was to properly understand the structure and the society of where it was. And of course, everybody said in those days that there was a funeral every weekend. There was somebody else that you heard who got infected. It was a time when Elizabeth Taylor was doing her advocacy because the president of that country had still not uttered the word HIV and AIDS. It was still a very different time. And I think that we do live in an adjusted time. But of course, our settings per country, per community is still very different. So while we can celebrate a turnaround in the AIDS response in many countries, even within those advanced economies, there are pockets of enormous stigma and discrimination. Those are words that are often used, but let's unpack that. What it means is the trauma, the pain, the mental health, and of course, people who are dying completely unnecessarily. Then, of course, you've got, for example, the South and countries that are less developed, all the challenges that come with that, especially when we look at the cultural aspects of where we are here in Asia, Andrew.
So I think what we all can tell from this work, the number of people affected, the fact that it's an international challenge, is that there are so many people working on HIV. It's like a huge international community of its own of people working to end HIV. I wondered if you could just tell us a little bit about the people that you've come into contact with and maybe what's impressed you about some of the work that you've seen.
And I smile because I think most of my closest friends are somehow from that community. I see us as a kind of a love army who are very skilled at what we do and very determined. You know, people who come from AIDS, you can always tell because there's always an urgency about what we do. We work very hard and we play very hard as well, because I think we understand the fragility of life. We've been touched by the vulnerabilities that we see all again with COVID. And even COVID is not quite the same as AIDS. You know, AIDS reaches into the most intimate part of our lives, which of course is sexuality, relationships, and family. So it's still a little bit different to COVID. There's enormous shame associated with HIV and AIDS in a way that other diseases don't carry that same level and nature of burden. So some of the people I've met, well, I've met you, Andrew, and that's always been a huge honor. We live close to one another in Hong Kong, so that's a great privilege for me. And who are some of them? Sharon Lewin, who I adore very much because she is a figure in global science and Australian science who has propelled us forward. Françoise Barry-Sanusi, who back in 1983 discovered HIV, co-discovered HIV, and was later awarded the Nobel Prize for that. And I mentioned these two people in particular because they're very, very special, because now, of course, what they're doing is that they're looking at immunotherapies, particularly cancer treatments, the way that it behaves, and how that gives us a head start or a different kind of head start on treatments, cures, and vaccines for AIDS. The shock and awe therapy that Sharon Lewin, made big groundbreaking work on. And I think how they brought together not only the AIDS community, but connected them to scientists who've been working for decades in cancer, showing them the connections so that each side understands the impact they're having on the other, because I think they had no idea before. And I would add one more person to that, which of course is Adiba Kamaruzzaman. I'm wearing the AIDS ribbon from the Malaysian AIDS Foundation in honor of their great work over there. And of course, she's the new president of the International AIDS Society. Sharon is the president-elect. So it's a tight circle of people, but I always love it when you walk into a room and you don't know anybody, because it means that there's fresh blood in our AIDS community. And I think that's, I wouldn't say AIDS community, I'll say in our AIDS family.
So we all know that we're living in another pandemic at the moment, with lots of the world shut down or trying to cope with COVID-19. How do you think COVID has affected the work on HIV?
Well, I mean, we spoke about it in the summer, didn't we? We met up and then we also did an interview together because I wanted to learn about that from you. And I came away thinking so much about the services that are not available to people in the same way. For example, the psychosocial support, even testing, those were obviously greatly impacted here in Hong Kong, as you told me, during the periods, not necessarily of lockdown that we had here, but great social distancing measures. And then Winnie Byanyima has been speaking about this a lot. I think, you know, there is a great mental trauma. I mean, I think that all of us working in this family have been dealt some kind of trauma through just losing people close to us or being connected to their stories in some way. And then now you're dealing with, you know, the mental health, I think, of this. I mean, Elton John wrote about it and he said that the mental health aspects are such a great challenge and that we need to talk about this more, especially in connection to HIV and also in connection to men. Obviously, there's some gender-related biases for why it's so difficult for men and boys to speak about it, notwithstanding women and girls as well. So I think it's been very difficult. And I think for a lot of people, it's also been a question of supply and demand. How do we go and access our medicines? How do you do it, for example, in communities like Hong Kong, where perhaps people are accessing their medicines by going on trips to, for example, countries like Thailand. And now with the travel restrictions, they're not able to do that. And of course, Andrew, for anyone listening to us right now, why they choosing to do that in the past is because it was so much more affordable to get generic medicines from other countries. So the playing field, so to speak, is not equal. Nothing about AIDS is equal. And people living with HIV are being disproportionately impacted by this new emergency that we're in. And it's very important for us all to not only remember, but to act on this, because you've got COVID as the big global emergency, but AIDS, climate change, poverty, heart attacks, strokes, whatever it is, they don't go away. In fact, I think they become exacerbated by the new challenge.
So I remember hearing you talk about the fact that lots of the people who were working on HIV are now being drafted in to do the work on COVID. I think this is something we see in Hong Kong and actually around the world. Is this something that you've seen yourself?
I mean, I was so touched by it, and I want to come here today to speak with all your friends, Andrew, and the wider AIDS family through AIDS Concern, through the gathering point that you offer us, because I want everyone to understand that all of us in AIDS are helping the world in COVID. Literally. I mean, you look at Anthony Fauci, for example, who has been incredible in trying to steer a more compassionate and more science-based response in the United States, obviously amid enormous challenges over there. And our heart goes out to more than 1 million people being infected in the United States in the space of 1 week, I think last week alone. I mean, that breaks your heart just thinking about that. Sharon Lewin is working on a vaccine for COVID-19. Her laboratory at the Doherty Institute was the first outside of mainland China to isolate the virus. Adiba Kamaruzzaman, who I mentioned earlier as well, she's working on Malaysia's national game plan on how do you beat this virus. And the same goes for Françoise Barry-Sanusi. Bernard Schwartblender over at WHO is chief of staff to Dr. Tedros. He comes from AIDS. I mean, the names go on and on and on. And you've got Robin Gorner, for example, over in the UK, who's now injecting an urgent momentum into the impact for long COVID sufferers, which is something that we still haven't looked at. I mean, what are the implications of being infected? It's not only mortality. For people who survive, it often involves, as we're now beginning to understand through its behavior and consequences, enormous long-term health consequences. For example, breathing difficulties. Peter Piot mentioned that after he came out of hospital. So, you know, it's a proud moment to hold on to. And if you are in a dark space right now, mentally, and don't know where your place is in the world today, remember that our community, our own community, is the architect for the solutions for COVID-19, the biggest threat to humanity since the end of the Second World War?
I think that's a really startling thing for us to think about, but also a very, I think, positive message for the HIV community about the role that's being played, not only in HIV, but now in supporting the world in this new challenge that we face. I was also really touched about the stories you were describing about people that you've met who've been affected, and you were talking about how it's affected yourself as well, in terms of the people that you know that have been lost to HIV/AIDS. Could you share with us a little bit more, James, about the way you've seen HIV touch people's lives?
I mean, just a story off the top of my head. I mean, there was a young child in rural China who was, and I remember this story from a couple of years ago because I was asked about it in an interview in New York, and it was very, very sad because his parents were no longer around and he was living alone. I think the boy was about 6 or 7 years old, and he was going into the forested areas around his home every day looking for some kind of wood and using that to survive. And once a week, his grandmother would come by and drop off some bed linen and something warm for him to eat and also to clothe himself in. And it made me so angry at the time. You know, it was so painful thinking about it that I wanted to go and look for this boy myself and see if I myself could take care of him in some way. Because I think it's, you know, how do I say this? It's just, it just goes against the fiber of us as human beings and us as families to not want to be with your own grandchild who's so vulnerable. He wasn't going to school because he was completely ostracized by this wall of having parents who had died of an AIDS-related illness. And there was another case of a boy who was living in a pigsty because his parents had died, presumably of an AIDS-related illness. I don't know if the boy himself was infected, but you know, sometimes you don't need to be infected physically. You can be infected by the stigma through and through. And at that time, I remember the story was told to me by the Chinese, the now Chinese First Lady, and she went to go and find him. She found him, and years later, I met the boy himself. But when she first told me about the story and how she met him, I said, how is he now? And she didn't say he's taller, he's bigger, he's stronger, he's going to school. She said, you know what? He's happy and he has dignity now in his life. And I think that's what it comes down to. It's not just about a health status of positive or negative. It's about having, you know, respect in your lives, having the respect of others and having respect for yourself. And sometimes you can only have dignity when you have the basic tools of education, something to eat, something to drink, and a plan for a future life to go forward. So it's much more than just, you know, tests and medicines and therapies, which is what some people view AIDS as being. It's actually just about living your full life as a human being. And when she told me that story, I remember it was back, I think, in 2009 at the ICAP, Asia Pacific AIDS Conference in Bali. I was just crying all the way through after that.
So you met him. So
how was he? When the First Lady told me about it, it was terribly moving in 2009. And when I met him, I think it was around 2015, 2016. I mean, he was great. I mean, he was just playing with all his friends. I mean, I couldn't get a word in edgeways because he was off playing with his friends. And I mean, you know, I'm probably just a grumpy old uncle off the side. So they weren't interested in talking to me. But, you know, seeing them was deeply, deeply moving. And that transformation of a life in those 7-8 years goes to show what is possible in life.
I think it also shows that the stigmatization around this thing, HIV/AIDS, remains very strong. I mean, this is what we see around the world. I mean, I think it probably applies differently in different places, depending on the social context. What do you think? Is taboo the same everywhere? What do you think?
In a sense, I think it's different because we have different cultural settings. we have different political settings, we have different pressures on us and different stresses. But I think also it comes down to something over here. So, people can say, well, there's a lot of education, there's a lot of awareness, there are a lot of campaigns, but it's so much deeper than that, as you know, Andrew. It's about being touched by someone's heart and about not building a wall between you and the next person, no matter who they are, no matter what their health status is. So I think in some ways it's our failing as humanity, as human beings, that we cloak ourselves in this unkindness, or sometimes it's not unkindness, sometimes it's just the fear of the unknown or fear of something big that you can't quite grasp yourself. But that's why we're here today. We're here to show and to demonstrate again. And I think we have to do this again and again and again, that people living with HIV are no different to us. They don't ask for more, and certainly they don't expect less. What they're asking for is equality across the board. And I think that's important to see that, they're not a burden on our society. They're functioning people in society. They contribute to our society. They allow us to prosper in society. And through that, we grow and improve the human condition as a world.
I think one of the things that you've been doing in your work, James, is working with the World Health Organization in terms of the Sustainable Development Goals. So I wanted to just ask you to reflect a little bit on that and tell us how you think the world is doing on this broader agenda. It's such a huge, diverse range of things. How do you think we're doing?
So for everyone who may not know, because there are many things to think about in life, and this is just one of them, we had the Millennium Development Goals that were set in 2000 and brought us forward. And they were largely focused around the issues that concerned low and middle income countries, particularly very vulnerable countries. And they centered over a set of very select number of goals, for example, HIV/AIDS being one of them. Of course, the world has changed and developed since then. So world leaders got together in September 2015, including all the leaders of the world, signing off on what we now call the Sustainable Development Goals. They're a successor set of goals, but in this case, it's completely different. First of all, there are more goals. There are 17 of them. And within each of them, there are together hundreds of targets. Then it doesn't just impact one country, it's for everybody. So for all the 190 plus member states of the United Nations. So they impact rich countries, poorer countries, the countries that fall somewhere in between. And it recognized that our world, through globalization, has improved in so many wonderful and beautiful ways, but that interconnectedness has also brought about a new set of frightening challenges that we now need to deal with. Health is goal number 3, so poverty is number 1. Health is number 3. It's specifically, they call it good health and well-being is number 3. And of course, we, people like Andrew and I, see goal number 3 as the underpinning one, that when you deliver on health, you help deliver on all 17 goals. So that's briefly what it is. And at the World Health Organization, we look, first of all, from my background in AIDS to me was the playbook on how you approach everything in life, to pan health, and now for the Sustainable Development Goals, how do you apply it to education? How do you apply it, for example, to gender inequalities? How do you apply it to climate change? How do you apply it to improving life below sea? How do you apply it to clean governance, peace and justice? So you can really use it in many different ways. But I tell you one thing, and this is the frightening thing that all of us think about now: if you don't have health, you don't have an economy. If you don't have an economy, you don't have development. And if you don't have development, you don't have peace. I went to the UN last September for a number of events. One of them was to speak at the launch report of the Global Preparedness Monitoring Board, an independent task force that had a mandate from the Secretary General to find out what's the big next health challenge. And we went out there in September 2019 and said a disease of pandemic or epidemic proportions was on its way. It could be tomorrow. It could be a year away. But we said it's on its way. And there'll be three outcomes. First of all, a serious loss of human lives. The second one will be the upending of global economic systems. But there's a third one, Andrew, that I'm really worried about. And I don't think we've really quite seen it evolve. And that is social chaos. We've seen pockets of it spreading around the world like mini epidemics. But I think, unfortunately, the social chaos that we warned the world about last September in New York hasn't quite fully arrived yet, and I think it will do.
So I'd be really interested to hear more, James, about your thoughts on how this health challenge is being communicated around the world, because clearly so many of us rely on understanding from the local and international media about what's happening. But with such an overwhelming amount of focus on COVID in different countries, we're only hearing about snippets of things from different places. You know, we hear about particular countries which seem to have huge numbers of infection cases, but we hear almost nothing about some other countries. I mean, what do you think about the information that we're getting about the international work on COVID?
Well, I think we just need to look back to AIDS. When I say back, that's not to dismiss the ongoing fight against AIDS, but certainly during the emergency period in the 80s, the 90s particularly, what we've learned in AIDS is that you need very clear messaging, a very clear public health messaging. That means that we are consistent with what we say. That does not mean, though, that that information doesn't change or that messaging doesn't change. A lot of people have been pretty tough on their governments, saying, why did you tell me that this was relevant 3 months ago, and now you say it wasn't necessary, or vice versa. And it's because, you know, science changes and our understanding of how a virus behaves changes with it. Also, how we as humans psychologically react to messages. You know, we may be told something is A, but we insist something is B. And in an era of digital media and social media, that A, B is just jumping to Z because of the wealth of conspiracy theories that are being fueled by a deliberate spread of disinformation. So it's, you know, when you ask me about what I think about today, I think some countries are obviously performing a lot better than others. I don't think it's always helpful for us to say which countries are doing very well and we praise them to no end, because very quickly that changes, as we've seen. And that's not necessarily through the fault of a government or a community. That's just a natural phenomenon of what this virus is. Do not ever underestimate that this virus is smarter than all of us put together, and no one country has got it completely right, because if they had, you'd have zero infections where they are. I think it's very important at this time to think about our people and all people who are vulnerable. How can they be protected, and how can they continue to live their lives fully in such a desperate set of circumstances? So instead of just looking at COVID-19 as, you know, the big virus and big pandemic of our times, how do we protect one another? How do we reach out to one another? And that's what I worry about a lot. I mean, Winnie Byanyima from UNAIDS spoke about this, Filippo Grandi at UNHCR, Tedros also. I mean, they've all been speaking about the vulnerable people in this. And you know what? The vulnerable people are not the same as the vulnerable people last year. That number has exploded, and the nature of what you understand as being vulnerable has changed completely. So I worry when I look around. To be honest, if you ask me about the global COVID situation today, I think it's a catastrophe.
Well, it seems, it feels in some senses like a huge international stress test to see what the ability is of health systems around the world to respond to the very challenge that you were talking about with people back in September 2019. So I think that we're seeing and we're learning, but I think what's very difficult is that often, as with HIV and other things, there's been work over decades to try and find the right interventions and treatments. But we're in the middle of this situation where people are dying.
And political leadership. I mean, this complete absence of political leadership in some parts of the world, the creation of failed states, because if there are people who are dying in huge numbers where you are, what kind of a country is it that you have? Sometimes it's through a lack of political leadership. And that's where AIDS comes in. I mean, AIDS has been incredible in that sense. And Peter Piot used to say that when he started off at UNAIDS, he said that, world leaders wouldn't want to, they would just dodge the bullet and just walk away when they see him coming into a room. But over the years, especially into the 2000s, they recognized the importance of HIV to economies, to national security, and also to global governance. And they would seek him out. They weren't turning away from him anymore. They were trying to find him. And I think that's where AIDS has really been the game changer in our world in the last century.
So I think that leads us on nicely to a question that someone's asked, which is about how HIV/AIDS organisations work in the current time of COVID. So the question is, what can HIV/AIDS supporting organisations do to support HIV prevention work in this tough period? So when there's all this chaos and this disruption, we're all having to get on and do our work. What do you think?
Well, there's one thing, of course, which are digital services. They're not a replacement for face-to-face. We talk so much about the absence of human contact, human touch. But certainly, if you're talking about psychosocial support systems, you can do that to some extent in the way that we're doing now, speaking across a Zoom-powered conversation. I will caveat that very quickly by saying that a lot of people, particularly in our communities, don't have a computer, don't have a power supply, let alone an internet connection or the necessary apps and toolkits and stability of the internet to be able to have a conversation like the one we're having right now. So that's one thing. Secondly, it could also be what you're doing in Hong Kong, Andrew, which is, I heard, because I saw a picture of it, you have a vending machine outside one of your testing centers in Jordan, which is in Kowloon, the Kowloon Peninsula in Hong Kong. And that allows people, obviously, to be able to insert some cash, so to speak, or swipe a card, and you'll be able to get an HIV test that drops down to the bottom like you would a can of Coke, but this is healthier. And this is better for you, knowing your status and then acting on that status. It's no good just knowing what your status is, of course, but what do you do with that knowledge? Can you then go and find the right, treatments for that? So, it amazes me that not only you have a vending machine outside in Kowloon, which I'm going to come and visit very soon, by the way, but that it's affordable to most people here, that you could do it 24 hours a day, that it's still physical, yet is accessible in socially distanced or even lockdown times. That buying an HIV test kit would be as easy as buying a bar of chocolate, but also that buying an HIV test kit is now probably or closer to being as socially acceptable and culturally acceptable as buying a bar of chocolate, which quite frankly is not very good for your body anyway.
I think you're absolutely right. I think still some people are a bit unsure about buying a test kit, but you're exactly what you say. One of the
we'll come and buy one. We'll buy one together.
Okay, let's do that. But I think you and I are probably not so worried about the stigma because we've been working in this area for a long time. I wanted to ask you a bit more about digital things. So you're actually host of the China Current, which is a digital storytelling experience. I think this is the way that you describe it.
Like a TV show. But we thought it sounds fancier when you say digital storytelling experience. It sort of sounded more slick, but we realized that I don't think anybody really understands what that means. So it's a TV show, but it's online.
So can you tell us more about it? What have you been doing?
So we started it 18 months ago, and we really wanted to, out of Hong Kong, to try and find stories of people who live around the country, what they're doing. It's not political. It's not really media as well. It's housed as a non-profit, and it's not government related. But, there was this great freedom to be able to tell these marvelous stories. Initially, I thought, well, we'd tell all these stories about the Chinese experience. But then I realized the Chinese experience, if you're 1.4 billion people and then some, because you've got 50 million members of the Chinese diaspora globally, there was this really rich tapestry that was not confined to these borders alone, but really swam through the world and were connected to humanity in good ways and sometimes in ways that need to be improved a lot. So the 5 pillars of our stories largely revolve around health. So we started doing stories about the next pandemic last year. And of course, we ran some stories on AIDS and mental health, gender equality last year. So health is one. And of course, COVID-19 has given us a big new mandate to try and help shape public understanding, not through us, only us as a gathering point, but through global leaders who are working on the international and community response. The second one is climate change, which I think is probably the defining issue of our times, even more so now than ever before. The Sustainable Development Goals, which the climate change, of course, is a part of, has, I think, fallen back a bit. You asked me about this, has fallen back a bit because of this emergency that's leapfrogged all the others. So health, climate change, poverty and hunger, culture, be it food, music, cinema, and then there's one more, technology, really looking at innovations and how they can move our lives. So people, for example, who are doing 3 simultaneous surgeries in a part of China, in Beijing, in the rural areas and Inner Mongolia, where they're able to use 5G technology to use precise and quick robotic movements to operate on people, especially people in hard to reach rural and very, very poor areas. So bringing health to people no matter where they are. So we're 18 months old. It's been a bit of a surprise because, I came from a television station that was huge before. And so all you had to do was just sit down and look in the camera and you knew there'll be tens of millions of people watching you that night. But with the China current, it was very different. I was a bit nervous because I was wondering if anybody would watch it. I was hoping that, 50 friends would then sign on. But I think last week we hit 700,000 followers on the China current. And it's a blessing. We're really humbled by we don't really have a mission. I think, if anything, our great desire is to bring people together in new and beautiful ways.
Well, I know you're releasing videos every week on different topics about what's going on in the region and in relation to these big themes that you're talking about. I know it's a huge amount of work, so thank you. It's really impressive, and we look forward to seeing what happens with it.
And our World AIDS Day special, week after next, is going to be my conversation with Andrew, which we originally did in the summer, but we're going to replay that. And this week, there is a 1-week special with Mary Robinson, the former president of Ireland, now, of course, chair of the elders. She's talking about climate change and bold ambitions. And then next week is going to be Art Basel with a look at that. But we can't wait for the November 30th, December 1st episode, which will be you, Andrew. And through you, we remember and honor every member of our community, especially here in Hong Kong. I've been doing a lot of work on AIDS globally, but lockdown and social distancing reminds us, sometimes you got to pause. Nature doesn't want you to move just yet, and take care of the people around you as well.
Well, that's a wonderful note to finish on. So I want to say a really big thank you, James. It's been a pleasure talking with you this afternoon, and I'm sure everybody has really enjoyed hearing your thoughts. So thank you so much.
And my best wishes and love to everyone at AIDS Concern in Hong Kong, all the people that you work with around the world. You have helped not only transform lives, but you've also helped save lives. So that's one of the biggest things you could ever do in the span of a lifetime. Thank you, Andrew.
Thank you so much. Well, this session has come to an end, so I'm now going to hand over for the next part. Thank you very much.
Yeah.
Look at me. I mean, really, look.
What do you see?
My strength.
My determination? My soul? Do you see a person who can be anyone and do anything?
Someone who won't take no for an answer.
Do you see a person who's never given up on a dream and isn't about to start? Do you see my fearlessness?
My pride.
And my passion. Or do you see my HIV?
I was hoping you'd say that.
Because while I may have HIV,
my diagnosis does not define me. And with your help, I hope to keep it that way.
This is my life.
And Devado is power reimagined.
大家好，歡迎又翻嚟我哋HIV Virtual Conference 2020。咁呢個環節咧係會用廣東話嚟到進行嘅。咁如果你唔識聽廣東話嘅話咧，你喺你自己熒幕上面 Zoom 嘅下低咧就應該會有一個掣係講 translator 或者 translation， 咁你咧就應該可以轉翻做英文嘅啦。好，我係江少琪 Travis Kong， 係呢一個環節嘅 moderator。咁我係而家喺香港大學嘅社會學系教書啦，副教授，同埋亦都係關懷愛滋嘅董事局嘅主席。咁呢一個環節咧就係叫做本地性教育、正面性教育同埋愛滋病之間個關係。我哋今日咧就好高興請到吳敏倫教授嚟到同我哋演講嘅。吳教授我相信好多人都認識佢㗎啦。咁佢有好多嘅銜頭嘅，我就講其中兩個啦。第一個咧，佢就係香港性教育會嘅創會會長，同埋亦都係香港家庭計劃指導會嘅理事會成員。咁但係咧我識咗吳教授已經好多年㗎啦。咁由佢之前喺香港大學教書啦，咁而家退咗休啦嚇，跟住佢亦都係一個嘅性治療師啦，亦都係一個嘅性教育工作者嚇，差啲想講性工作者添。咁咧就吳教授喺香港嚟講咧，一路都有好多好出位嘅言論，亦都有好多人對佢嘅言論有好多嘅睇法。咁我睇吳教授喺香港成個性教育嗰個發展裏面咧，係扮演咗一個好重要嘅角色。因為喺佢嘅言論裏面當中嘅時候，我哋去睇到言論同埋實踐之間個關係，亦都知道性教育個重要性，甚至乎係更加嚟到正面地去了解到性喺我哋人生裏面嗰個嘅重要嘅地方同埋嗰個意義喺邊度嘅。好啦，我嘅簡單介紹到呢度為止，我而家將時間交俾吳教授，歡迎吳教授。
好，多謝主持人，多謝各位嚟聽我講呢個正面嘅性教育同愛滋病。咁今日嘅講性教育咧，我係強調嗰個正面呢一方面嘅事。咁喂，嗰啲好多人會問，教育梗係正面嘅啦，咁使乜講啊？咁可能好多其他教育啦，可能咧就唔使講都係正面嘅啦。但係咧性教育就唔係喎，因為咧好多人對性本身都有一個即係本身有一個禁忌㗎啦，佢自己有個陰影嘅咁曹生講親性都係唔好人㗎啦。咁然後咧就反對啊，咁然後因為佢越唔識咧，咁咧就越負面咯喎，嗰個嘢嗰個態度，咁咧就搞到咧性教育咧就好難實行嘅，即係真係有一個一個正面嘅效果咧係好難嘅。咁呢個尤其對於愛滋病人咧就或者仲或者帶菌者啦都有好多嘅不良嘅影響。咁所以咧今日咧我就講一個呢個正面性教育呢件事，即係點解咁難咁我嘅經驗係點樣？ 咁即係主辦單位要我講多啲我個人嘅經驗先喎，因為真係咧，佢呢個經驗咧係即係嗱，我呢個經驗有幾廿年㗎啦，即係嗰個感受就好深嘅咁就可以咧俾人睇到啦即係我做性教育都咁深啦，何況咧喺性方面有啲困難嘅人有啲疑難嘅人咧，其實你都可以體會到咧幾咁慘。咁所以我就而家開始啦。咁我做乜嘢會搞嗰個性教育先？因為我係醫生嚟㗎，係嘛？咁然後咧，我又唔係性初我唔係一個同性有關嘅醫生嚟嘅喎，我初學精神科嘅喎咁我當然係醫科畢業啦咁然後咧就做一個咁我就對呢個精神科咧好有興趣嘅，因為嗰陣時咧50年前啦咁樣咧就精神科醫生都好少㗎啦因為又係一個好僻好有俾人有偏見嘅行業嚟嘅，即係好正經醫生唔做精神科醫生自己有啲精神病咁樣咁但係就係因為缺乏精神科嘅醫生，咁我就去做，而且我哋真係好有興趣呢一方面嘅嘢，因為精神科醫生同心理社會嗰個關係好大咁咧喺精神科醫生嘅即係學習嘅時候咧，我又去學咧精神科醫生多數唔學嗰樣嘢喎，即係點解咧？精神科醫生嗰陣時咧就係學就點樣醫精神病，但係咧佢就淨係識淨係中意唔係話識係點啦總之咧淨係去開藥嘅啫，或者係電療電腦咁樣去做一啲好物理學上嘅方法去醫精神病。咁當然我諗大家都知道啦，精神病係好多心理問題佢哋唔係你電到佢暈晒，乜嘢都唔記得晒咁就好，咁嗰啲你話好假㗎啦，係咪咁所以咧，即係你要同佢開解下佢嘅心理啊嘛，係嘛？咁要同佢傾偈但係傾偈又好嘥時間嘅事，亦要好嘥腦筋嘅事。咁但咁呢一科有得學嘅，咁就叫心理治療咯。咁我初係學心理治療嘅喎，我去到外國真係留學就係想去學心理治療，咁亦真係好多嘢學。但係嗰陣時咧就啱咧，就嗰個性治療啱有人發明咗咁樣咧，亦咧喺你做如果心理治療咧，會發覺好多人嘅心理問題咧同性好有關嘅。咁呢個喺理論上心理學嘅理論都即係已經講咗好耐㗎啦，不過好多人唔信啫嘛。弗洛伊德一早就講就係性同個心理嘅關係幾密切啦。但係即係弗洛伊德嘅嘢唔係人人聽得入耳㗎，亦係俾人鬧㗎咁樣咧咁但係咧因為我知道呢個咁重要，咁咧就嗰陣時啱有性治療，咁我學性治療咯。好啦，咁學到性治療咧，你就會發覺咧，你其實要顧嘅咧唔係淨係人嘅心理，你要顧埋社會嘅心理因為人嘅心理係同社會嘅心理咧影響好大嘅即係個社會點諗咧，佢就唔到佢個人去控制嘅，反而個社會嘅諗嘅嘢咧個壓力好大嘅，俾佢個人咧咁樣咧。我就覺得，如果你想做性治療做得好你咧或者心理治療做得好咧，你一定要做個好嘅性教育先得。做起好嘅時候，成個社會嘅性教育要好，因為咧如果個社會唔好咧，永遠就俾啲壓力壓住啲嘅個人咁嗰個個人想掙扎出嚟喺個性問題裏掙扎出嚟咧，就好難嘅咁所以我覺得。你治標咧，你咧就一定要做埋唔係你治本咧，一定要做埋性教育咁所以咧，我就到咗1985年咧，就開咗個香港性教育會，咁喺度搞性教育。咁當然我呢個會唔係淨係做香港㗎，我一路擴充出去嘅咁咧性教育咧有個重要性我諗喺度都唔即係講得我驚冇時間講下。個重要性，佢第一佢係頭先我講，佢可以 防止嗰個社會嘅發生問題，即係個社會唔會阻礙個性教育嘅發展嚇。咁咧，因為性教育咧可以教到人防止疾病啊嘛嚇。你醫病咧最緊要預防勝於治療啊嘛嚇。咁所以唔可以等佢病先搞嘅。咁預防咧你就要就預防乜嘢有關性嘅病都得㗎啦。譬如啦性傳染病啦，大家都知啦嚇。咁然後性機能病啦，咁然後一啲嘅所謂性變態啦，其實一啲叫做性變異啊。我哋即係如果唔用歧視嘅字眼咧，性變異啦咁其實好多病，一個人身體逢親有嚴重嘅病，其實都影響性㗎，影響性生活㗎。你諗下你跌親個腰骨，你都有排冇性生活㗎啦，係嘛？咁嗰個好麻煩㗎喎，冇性生活咁但係好多你話骨科醫生佢醫好個骨㗎啦，你行得就算，佢唔會問你喂，你性生活得唔得啊咁咯？有冇影響啊？成個時間半年內你點夾變辦啊？咁所以咧，你好多病啊，譬如你話婦科梗係影響啦譬如婦科病，咁嗰個如果係老婆嘅咁佢應付唔到老公嘅需要㗎咯喎咁即係乜嘢病，其實乜嘢病你諗到嘅任何病一病起上嚟都同性有關嘅咁所以咧個性教育係個重要性係咁緊要咯。咁咧咁嗰啲我頭先講呢兩樣嘅緊要，同社會問題嘅幫助，同埋對呢個病人本身嘅幫助都係需要正面嘅性教育。但係呢啲其實都唔係叫做正面性教育喎，呢啲其實係咩有病嗰陣時醫病，有問題解決問題。正面其實要你係製造幸福先叫正面啊嘛，係嘛？我頭先講嗰啲係預防病啫喎，唔係製造幸福喎，預防社會嘅問題喎。所以其實性教育咧，仲要做一種更正面嘅嘢㗎，即係乜嘢啊？你要提升人嗰個幸福感，整個社會嘅幸福，人嘅幸福感人與人之間嘅愛然後咧大家嘅合作，一種嘅社會嘅平等，人人平等，你唔會歧視嗰啲有性問題嘅人嘅咁樣你先至係嗰啲有性問題嘅人，佢醫好咗之後做冇事啦，佢點樣可以攞翻佢自己嘅幸福咁所以咧譬如我而家其實咧，我退咗休啦，係嘛知啊？咁我其實做好少嗰啲咩醫嗰啲咩性治療嗰啲啦，我唔做啦。我而家集中做咩啊？做愛情教育愛情，喂，你話愛情教育係咪好重要啊？係啊，梗係重要過性教育添啦。因為咧，我就講啦，你要正面嘅性教育，就一定要有即係追求，靠到人點樣追求性嘅幸福。性嘅幸福就包括愛嘅幸福咁樣咧，而家社會上我見性教育反而有人做我啲徒弟好多都做性教育啦，做得都唔錯啦。但係愛情教育，你有冇聽過香港有人做過有上邊嗰啲咩KOL 嗰啲有啲網上嗰啲你聽下佢哋噏嗰啲嗰啲真係唔掂㗎，教壞人㗎。我聽到我真係咁真係冇人咧，即係好深入去做個愛嘅教育咁所以咧我所以呢個所謂正面嘅性教育就包括呢3個重點啦咁所以咧我咧就即係1982年啦，頭先講咗咧就係做咗呢個性教育會啦。咁出咗嚟之後咧咁我就喺電腦係咪嗰陣時未有電腦啦喺電視電台有報紙嗱咁睇到我咧寫好多呢啲咁嘅嘢呢個成立嘅陣時啦，咁呢個我就喺度促進香港嘅性教育啦，想話叫學校唔該你教啲正規啲嘅，同埋咧我哋考試啲學生係講老師就係你唔考試咧， 會考唔考咧，佢就唔教嘅。咁所以但不過促進唔到啊呢樣嘢，而家都唔會會考教啊。咁啊好啦，咁啊嘅去呢個立法會啊，講點樣啲婚姻啊條例草案啊，咁啊我都俾意見啦。咁但係都其實俾就俾意見咋，但係做就做咋，我唔俾人鬧已經好夠運啦嚇。咁啊你立法會嗰啲邊度睬我啊嚇？即係佢哋會叫我上去講下嘢嘅，講完就當聽唔到咯，係嘛？咁我就仲做好多嘢嘅，做性教育嘅調查啦，知道睇下香港嘅性教育嘅水準到咩地步啊，要教啲乜嘢啊？咁我每5年我係家計會嘅人員啊嘛，咁家計會同家計會合作，就每5年都做一個啲性教育嘅調查㗎，5年做一次，即係睇下有冇進步啊，要教啲乜嘢啊咁樣啊。咁啊有做性文化節啦，我諗你喺香港有啲即係有啲年紀嘅人都會知道啊，我做過好多屆嘅性文化節啊，即係直情即係好似搞會展咁樣，搞呢個工展啊咁樣啊，即係一個慶祝會咁啫，等人哋喺一個好鬆弛嘅即係一個集體嘅聚會裏邊，有啲娛樂啊咁嘅聚會裏邊，有啲新嘢睇嘅就咁嚟到咧學性教育啊，咁啊我又唱歌啦，同周一嶽唱歌，我喺度嗰次第6屆，咁樣嚟做呢啲嘢咯啊，咁樣咧咁我做嘅嘢仲唔係淨係香港做啊？我都講咗啦，因為我都要學睇下外邊點做啊咁所以咧我同譬如澳門啊、台灣啊、大陸啊都做好多呢啲性教育啊，同佢哋一齊做啦，叫佢哋能夠幫我做啦，我又去嗰邊幫佢做啦，咁咪一度交流啦，去佢嗰度教書啦咁樣嘅，咁樣交流，咁啊同世界都有交流嘅咁啊世界性學會咧喺1999年咧喺香港開佢個世界會議，咁嗰陣時個影響都好大嘅。咁你話喂，咁你做埋單性教育有冇咩特殊對愛滋病嗰個性教育有冇即係做嘅咧？有啊我其實咧好即係嗰陣時做性教育者咧，我都同Teenage有做過嘢㗎啦咁我又喺嗰啲其他嗰啲有關愛滋病嘅喺衛生署啊嗰啲愛滋病嗰個中心咁做呢個顧問咁樣咁喺國際上咧我都去過，譬如我同啲國際嘅愛滋病中心譬如德國愛滋病中心上海嘅性研究中心咁都做過啲合作做呢個性教育展覽咁樣。咁喺世界衛生組織咧，都好多時都揾我咧。如果係有愛滋病題咧，佢揾我識得揾我喎。嗱，咁所以我可以知道咧，愛滋病同正面性教育係幾重要啦佢哋識得揾我嘅，佢唔會話以為愛性教育愛滋病冇關係，唔係嘅，好重要嘅我所以喺世界衛生組織都做過好多即係顧問，好多次嘅顧問或者咩嗰啲啦都係同愛滋病有關嘅。咁就初愛滋病開始嘅時候，大陸就係想睇下點樣應付愛滋病咁都係咧我幫佢哋手去組織嘅。咁但係咧做就做咁多嘢啦，俾人鬧成點咧？你話呢度俾啲公仔你睇下啫即係呢啲係一小部分呢個咧。無端端咁即係當啲報紙當即係漫畫咁寫喺度話即係刺激過度咁其中咧就係因為啲3級片霸就周圍都係 A 小姐 B 小姐嗰啲咁樣，周圍都係卒之講到最拉尾咧，講到吳敏倫出係吳敏倫顧問呢個佢又唔叫做吳不倫吳不倫顧問就係咧即係搞亂呢個世界嘅人咁樣 咁啊真係當笑話咁擺喺嗰度喎，擺喺報紙度喎。咁然後咧有咩狂人惹禍啊嚇？你嗰啲咁嘅媒體咧，個報紙啲記者走嚟訪問我咧，咁我以為可以宣傳下啦，講下性教育啦。先佢哋講訪問完我之後咧，話我狂人喎，係淨係識惹禍嘅啫喎。咁啊西部咧都話吳敏倫咧都係要去審下㗎啦，要去受下審啊。咁啊又性學家幾時死啊？咁啊有啲係嘛？咁啊呢啲啊婦女團體啦，派個獎俾我叫人面獸心獎人面獸心獎咁然後有啦吳敏倫即係精神科醫生嚟嘅，梗係啦，佢黐線㗎長期維和獎咁呢一小部分咋嚇？其實呢個費事講咁多啦。咁你話咧幾難做咧？即係你一個好似我呢啲人咧出嚟，即係都唔怕死咧，走咗嚟做下啦咁咧你受個壓力幾大咧？其實我啲好多徒弟啊，我教過好多女，即係希望佢成我衣缽咧，有到做學下，初佢哋好有興趣嘅，學下佢哋驚啦，佢哋唔敢做，就係因為俾人鬧嗰啲人冇鬧得佢哋咁犀利㗎，佢哋徒弟仔啫嘛。但係佢哋都已經即係感覺到而且有啲根本老婆唔俾佢做下，老婆話即係冇面見人啊！有我會講老公係做啲咁嘅嘢，冇面見人，咁所以唔俾佢做咁所以咧，你話正面性教育幾難咧？因為你對面嗰個敵人係好強個力量咁咩叫做正面性教育咧？咁講咗嗰個目標啫，但係未。點樣做咧？就主要有幾個有4點嘅。第一，當然係要係即係唔可以即係道聽途說啦，啲嘢一定要有事實證明。所以我一定要做呢個調查呢個臨床研究我哋好多啲臨床研究嗰啲咁你就唔可以係靠人嚇人或者用強權嚟到唔俾人出聲嗰啲咁樣嗰啲咁嘅嗰啲性教育就為咗就呢個社會做嘅性教育，社會唔俾你做你就唔做，咁你永遠做唔到嘢㗎，呢啲就永遠唔會正面性教育㗎啦。一定要有邏輯嘅，有理由嘅，你啲嘢係要有理由去支持嘅。唔係靠呢個幻想靠重複講咗大話講100次就係真理唔係咧走去俾人哋俾啲污名化人哋咁樣即係你一定要有抵抗到啲污名添，仲要同埋咧好多嘢你唔好好多時咧好多人咧就佢自己唔中意就當人都應該唔中意咁但係好多時咧，有好多嘅性行為性興趣係兩個人嘅事嚟嘅，即係影響唔到第三者嘅。只要佢哋係互相同意嘅，咁咧你就應該俾佢容許佢，唔應該笑佢即係嚇佢咁你唔可以用呢啲咁嘅即係製造誤會或者根本唔睬佢唔理佢排擠佢咁樣嚟到即係睇待一個即係不同嘅性行為一啲不同嘅性行為咁仲有就係健康嘅當然健康係重要咁但係佢講咗啦，健康唔係淨係話冇病咧，一個人冇病未必一定健康嘅。如果佢自己一朝到晚唔做嘢周圍賴死周圍人咁嗰啲都唔係健康嘅人啦，係咪？咁所以咧，根源健康係使到一個人能夠係根據佢自己嘅能力去成長，自己嘅興趣去成長，而有得到嗰個滿足咁呢個滿足咧係唔淨止係身體上嘅或者精神上滿足，仲有喺社會上覺得自己係有一個地位，俾人哋至少即係尊重或者接受咁樣咁但係即係喺性教育裏邊咧，就個方法咧點做咧，就即係唔可以講得咁詳細啦但係咧講啦，我做咗咁多年， 幾廿年咁而家香港有冇進步咧？即係嗰個性教育、正面性教育有冇進步咧？咁我咧就都本來根據嗰啲調查咧，都話有啲進步嘅，但係都知道咧，一路幾廿年咧係有進步，但係啲進步咧係唔夠嘅，即係遠遠唔及我哋所理想嘅範圍嘅，個程度嘅。咁所以咧，佢哋係有進步，但係咧就其實仲差好遠。嗱，咁舉幾個最近嘅例俾大家知啊。2018年呢個人哋好多地方台灣都呢個同性戀結婚合法化，但係咧2018年咧仍然咧呢個特首都正話未有呢個計劃咧去俾同性戀婚姻合法化咁2019年呢個高等法院其實就先喺立法會咧就討論過嘅，即係咧變性人應唔應該俾佢變性而譬如應唔應該佢話佢想做女人，你就俾女人身份證佢；男人想做女人就俾女人身份證佢。咁咧我就做變性㗎，我同變性人變性嘅，我個做團隊。咁咧我哋咧就嗰陣時好耐，即係40年前、30年前嗰陣時咧，我哋就將嗰個男人如果想變性咧，就切晒佢啲性器官嘅，就要俾個假嘅女性器官落去。咁然後咧有嗰個警方或者咩個移民局有呢個證明佢個器官已經變晒啦，切晒㗎啦，要切晒，然後先至可以變先至可以俾女性身份證佢，即係個男人俾佢。咁但係其實咁樣係好殘酷㗎嘛人哋又想做女人啫嘛即係你唔使人哋切晒，因為咧切晒係一個好大嘅手術嚟嘅，好危險嘅手術嚟嘅。咁有時候有啲人身體個狀況唔得㗎嘛，好似你承受唔到㗎嘛其實又冇理由㗎，係嘛？嗰個其實係一個心理嘅認同嚟嘅，你唔使嗰個身體真係去切晒。咁我咧就喺2019年就上過立法會講過，而家呢個世界已經唔興㗎啦，已經知道咁樣係唔人道㗎啦但係佢哋我聽完我講完咧，就卒之都係決定一定要切晒。咁呢個時咧喺世界上咧已經係一個落後嘅決定嚟㗎啦，喺好多地方你已經冇咁嘅嘢㗎所以咧呢個即係進步有限啦，即係話最近最唔進步嘅例子，啱上個月而家11月、10月啫，仲唔係有啲人喺東九啲西九龍中心話睇到呢啲咁嘅呢啲咁嘅嘅廣告嘛掛咗個大牌喺度話太色情喎要投訴喎，要人哋拆翻晒落嚟喎咁樣就點知人哋都已經去咗淫審處，俾淫審處審過㗎啦，但係都有人話唔可以接受，咁所以咧呢個就嗰個好差啦，即係呢一種嘅。咁咧愛滋病咧或者愛滋係一個好有呢個呢個標籤化嘅，好被標籤化嘅個病，因為咧好多人覺得呢一種又係好危險嘅病有咗帶咗愛滋菌啦，就係掂唔到㗎好容易傳染㗎嗰啲人咧就有呢啲病人咧精神有問題多數都係性狂魔呢啲好多就係話佢哋又濫藥等等一係就係妓娼妓咁樣，咁搞到咧有啲人咧佢自己咧都如果一有呢啲病咧帶呢啲菌咧，就會覺得自己都即係低人一等，咁搞到好多呢啲病人咧，即係本來唔需要嘅，都搞到憂鬱症對自己嘅眼光睇得好差啦佢咁樣搞法咧就會有咩問題咧？ 會搞到咧有啲人咧唔會主動去求診啊！即係如果有少少可能性病嘅症狀啊，都唔會求診啦。咁佢哋嘅即係唔會去求人哋醫啊，更加唔會求醫啦。佢唔會驗先，佢唔會驗先啊！佢驗都覺得醜啊！係㗎，我哋話性診所啦，我哋唔敢講我哋叫性診所㗎。我哋叫做即係一般精神科或者特殊精神科診所係咁㗎咋。咁咧搞到咧，即係大家都唔對於防止同埋去防止呢個病偵察對呢個病同埋醫呢個病咧好多困難。咁人就好用好多傻嘅字眼咧嚟到即係標籤嗰啲愛滋病人添，或者帶病嘅人嘅。咁用嗰啲字咧，你有時你唔小心咧，你就唔覺得係對佢哋有歧視嘅，但係佢好多時咧，你歧視咗都唔知嘅。呢度俾啲就係俾個即係一啲嘅即係例子啫。咁我唔讀個講啦。咁所以點樣咧？就係搞掂呢事咧。我哋先要搞到呢個社會冇晒對性嘅一般嘅禁忌先，咁你先可以幫到愛滋嘅帶菌者或者病人得到即係應該有嘅服務咁同埋咧要教下人點樣喺嗰個性觀念度咧，將性咧係唔好成日講埋一種係一種恐怖嘅嘢或者負面嘅嘢，你要講多啲性嘅愉悅先得噶嘛。呢個先至係呢個你係唔可以避免嘅講啊嘛。你愉悅咧唔係一定就係即係變咗過度即係男性嗰啲喺有某一個地方喺一個程度上嘅行為咧係愉悅嘅行為。咁你有愉悅啦，咁你教人食嘢食得好食得舒服，你唔係話就唔顧衛生噶嘛。即係好多人就係將呢樣嘢溝轉，咁我哋要分開等呢個等人咧對自己嘅性嘅需要可以接受。咁嗱呢啲咧都係我嘅即係咩咧？我嘅即係意願啦，希望能夠做到啦。但係咧，我可以話咧，其實仲有一段有好長嘅時間，先至真係達到一個正面嘅可能性正面性嘅可能性嘅。咁希望大家努力啦我講到呢度咯，多謝各位。
多謝晒吳教授，即係俾咗我哋一個咁精彩嘅一個演講啦。咁即係時間關係，其實我哋即係收到有即係唔少嘅一啲提問嘅。咁我問你一個問題啫，咁係啲觀眾問嘅問題。咁大家都知道，即係性教育當然係大家都覺得好重要啦。咁但係咧，你都知喺中國人嘅社會裏面咧，成日都會覺得性係一個禁忌啦，又或者會覺得你講咗咧，佢哋就會去做㗎啦。咁但係點樣可以用一啲咩方法令到學校或者家長佢哋真係可以願意嚟到去正面啲去教授俾佢哋啲學生同埋子女呢個嘅性教育咧？
係咁咧，其實咧我哋而家都有做好多，即係唔係我我而家冇啦，就係我啲徒弟。我啲徒弟喺邊度咧？就家計會好多徒弟，咁其他好多啲類似嘅會咧，我都有有我啲徒弟喺嗰度做嘅。咁佢哋有咩咧？好將有做好多呢個老師嘅性教育有㗎。你上翻幾個月啦，佢走去佢就唔係時開你注意下嗰啲團體家計會家福會咩嗰啲佢哋有呢啲嘅，又有父母性教育嘅團體嘅課程父母性係有嘅。咁但係即係你要時時去注意下先得咯，上去個網睇下幾時有，或者你去詢問下啦即係佢哋就唔係做得好多， 即係間中1年做1、2次啊，但係自己個時間就唔係一定規定啦，所以變咗好難去捉摸到㗎。我都捉摸到幾時開㗎。咁但係咧，亦唔係開得多，點解咧？其實都唔係好多人嚟嘅。你開咗嗰啲人間嗰啲嗱，你鬧你話學生，唔係你話啲家長，話啲老師，你點解唔教唔學性教育啊？點解唔教啊？咁佢話我唔識啊嘛，唔識咁啊喂學啊咁，佢又唔去學喎。嗱，點解佢哋唔去學咧？我問過佢哋㗎，嗰啲老師話：喂，學啊嘥時間，又要錢喎，咁然後咧學咗唔做咧又唔得喎，但係做咗冇功勞啊，唔計數啊！你升職啊唔計數啊！你不如咧，你嗰班如果你係數學嘅，你嗰班多啲數學會考優嘅咧，你就升職啦，係咪？你性教育優冇人理你㗎，邊個知你性優唔優啊？係嘛？所以你呢個政策上嘅嘢咯。咁政策上嘅嘢，你要搞咩啊？要搞立法會啊，同高官傾偈咯。但係佢唔又話唔睬你啊嘛，係嘛？我同佢哋傾好耐啦，唔睬你㗎。係佢年有啲乜嘢嘢問下我，徵詢過唔問論意見啦。係你徵詢過，不過你唔聽啊嘛，即係佢覺得話咁多嘢好做，要做呢啲嘢，個個都唔敢即係伸嘢頭出去，即係俾人哋鬧，俾人駁啊，知唔知啊？你做政府都係咁啊，你做高官係咁。你唔好做埋先，仲要俾人駁嘅嘢，俾人鬧嘅嘢噶嘛，即係吃力不討好啊嘛。
OK， 好，唔該晒吳教授。咁我哋今日聽咗一個好好嘅一個信息啦。希望我哋香港唔單止有性教育，亦都好似頭先阿吳教授咁樣講，我哋有愛情嘅教育。呢個環節到呢度完啦，拜拜。
好，拜拜。
Okay, so I'm Andrew from AIDS Concern, and I'm really pleased to be moderating this next session of the AIDS Concern conference, which is all about what's been happening in London, where we've seen over the past few years that HIV infection rates, particularly among gay men in London, have been falling by significant amounts. So this, I think, is really important information for us. London has and the UK have an MSM HIV epidemic in the same way that Hong Kong does. So I think it's really important that we can find out more to help us see how is it that we can look to end HIV by 2030 in Hong Kong. So I'm really pleased that we're being joined for this conference by Mr. Alex Sparrowhawk, who works at the Terence Higgins Trust, which is actually one of Europe's largest HIV and sexual health organisations, who've been doing tremendous work over the past decades to stop new infections and also support many people living with HIV. And Mr. Sparrowhawk works in a program called HIV Prevention England, and looking very much at how can they increase HIV testing rates, how can they make sure that the community has access to different HIV combination prevention options. They've published a lot of work on this and have done a lot of research in the community and a lot of community education work. So, Alex, we're really pleased to have you join us. Thank you very much. It's very early in the day for you, so thank you for joining us at this time. And I'll hand over to you to make your presentation.
Thanks, Andrew, and thank you for the invitation to speak this morning. Terence Higgins Trust, as you said, is one of the largest voluntary sector providers of HIV and sexual health services in the UK. Here's just some of our current priorities. Obviously, with the impact of COVID-19, we've had to address that as well, but we're still trying to ensure that HIV and sexual health isn't forgotten by key decision makers at the moment. And just to give you an idea of HIV in the UK at the moment, there are an estimated 105,200 people living with the virus, And as stated before, the largest cohort is MSM, with 44% of the population of people with HIV in that category. And the second largest cohort are Black African men and women. Additionally, 29% of the UK cohort is female. And looking at new diagnoses in 2019, 41% of those were MSM, 28% were female, and 14% were Black African men and women. Obviously, globally, transgender women are seen as a key population as well. In the UK, this population is quite small. There's 151 trans and non-binary people with HIV, of which 74% are trans. The latest HIV surveillance and testing data was published by Public Health England just a couple of weeks ago. So it's a great opportunity for us to look at this fresh new data. And luckily, for the purpose of this talk, we're still seeing a decline in new diagnoses in London. As you can see here, this top blue line is by exposure category, sex between men. And we've seen a continuing reduction in that. And we've seen the steepest fall in London within this group. But there still are declines in heterosexual contact and via injecting drug use as well. And the decline has really been put down to the evolution of the combination prevention approach in the UK and the different ways that we're working here and in London to improve awareness around HIV prevention and introduce new tools and methodologies to do this. I did just want to start by saying that we don't actually have any published data around PrEP use as such. Essentially, in England, routine commissioning has started this year, but hasn't fully rolled out across the country. Some areas, such as London, have seen clinics already open up and provide PrEP on the NHS. PHE haven't really spoken too much about PrEP in their latest report, but they did hint to it, as seen in this quotation here, in their report last year. So they do believe it is having an impact, but that remains to be seen as to what extent. And we know that the other approaches, so the increase in testing and availability of treatment, are having a large impact as well. We do have some data around PEP use, and as I guess to be expected, we're seeing a reduction in MSM accessing PEP, probably because of the increased access to PrEP. But interestingly, we're actually seeing more heterosexuals in the capital accessing PEP. And of the prescriptions within London, in 2019, 74% were for MSM still. So to talk about treatment, the UK has been surpassing the UNAIDS 90-90-90 targets for 3 consecutive years now. 94% diagnosed, 98% on treatment, and 97% achieving an undetectable viral load. London is edging just slightly ahead and has surpassed the 95-95-95 targets for the past 2 consecutive years, achieving 95% diagnosed, and then the same measures for treatment and undetectable viral load. We're going to look now at just some of the testing data for England and for London to maybe suggest why London is just slightly edging ahead in terms of achieving a better diagnosis rate. So London accounts for 38% of the total population of people with HIV in the UK and 32% of the undiagnosed. But as we can see from this graph here from PHE, that number has reduced dramatically over the years, and it's now 2,100 people. Under just half of those are gay and bisexual men, and the others in our main cohorts. So we're really at a stage now in London where out of a population of sort of like upwards of 10 million or more, we're really looking for small numbers to try and find these people and diagnose them. This is a look at testing in English clinical services across the whole country. And as you can see, testing has been increasing for the past 5 years. And most of that is attributed to this rise in testing by the internet, which is the dark blue bar at the top. And this is clinics offering postal testing kits, which are then processed in a lab and results sent by text or via a phone call, depending on the result. Overall, the testing in specialist sexual health services has declined slightly, which is the largest proportion of testing that you can see there. However, if we look specifically at London, we can actually see Whereas heterosexual men and women are testing in these specialist sexual health services, so sexual health clinics, is reducing, we're actually maintaining the same level of MSM testing. And actually there was a slight increase between 2018 and 2019. So it's good news that MSM are being seen in these clinics within the same numbers and that we're not losing numbers here. Looking back at the national picture, these graphs here look at the National Home Self-Sampling Service and testing in HIV community settings. And whereas the positivity rate for UK sexual health services has remained stable at 0.2%, we actually receive a higher reactivity rate, because this is point of care testing, via these services of 0.5. On the right of this top graph, we're looking at extremely high prevalence areas within England. So this is large parts of London, but it does also include Brighton and Manchester. But as you can see here, testing in these settings produces a high reactivity rate, which proves that different testing methods are required if we're to reach everyone that needs testing. And particularly if we look at community testing, we know we're reaching a different proportion of people that, as compared to the home sampling service. And in particular, as a percentage, we reach more first-time testers, more women, more Black African people, and more heterosexuals by testing in these means. To focus in on London and looking at some of the largest risk groups, so MSM, Black African heterosexuals, and also those diagnosed in a high prevalence country as defined by the UNAIDS definition, we can see that we're receiving the highest positivity rates in those who had not tested the year previous. And this really shows that there's a call to action for us to reach out and find first-time testers or those who haven't tested for a while. And this is being seen in across all those risk groups and really helps us to know who we need to target and where. Focusing in on MSM, this table here is quite a lot of data, but what it's showing is MSM who were diagnosed with a bacterial STI in the year previous, the percentage of those returning to the clinic, and then whether or not when they returned they will offer a test and whether they accepted it. And as you can see, STI rates within the MSM population have been rising over the past 5 years, but what's good to see is the reattendance percentage is increasing as well. And actually London is now offering 95% of these reattendees an HIV test, and we're still seeing high acceptance rates, and we're seeing high positivity rates from doing this work. Unfortunately, this isn't happening across the rest of England, and in some places the offer of an HIV test at reattendance is as low as 77%. So this really shows why in London may be edging ahead in terms of diagnosis, because they are really targeting these groups where we know we're going to get a high positivity rate. And also we know that this type of testing is accepted by the community. And across all regions of England, more than 95% of MSM will say yes to an HIV test when they return to a clinic. So that's a little on the latest data. I'm now just going to talk about how London's responding to HIV. London is really set up to respond to the epidemic here. It's a large and it's an active sector, and it's supported by national leadership. There are a number of organisations, and obviously bolstered by our National Health Service and Public Health England, and as well as some specific London-wide initiatives, namely the London HIV Prevention Programme, which runs the Do It London campaign, and also Fast Track Cities London. We're also lucky to have support in the UK from public bodies like British HIV Association, British Association for Sexual Health and HIV, who provide clinical guidance for clinics and who also work closely with the community. And as you can see, there are a number of organisations that work with communities around HIV prevention and supporting people to live well with HIV. Just to look at some examples of some of the things going on in the capital, I'll start with 5016 Street, which is an NHS clinic, but as you can see in the photos, it doesn't really look like your usual hospital clinic at all. The photo on the left is their main clinic which is situated in Soho, the traditional centre of London's LGBT scene. And it's really more akin to a business lounge in an airport than a sexual health clinic. They've really brought into the LGBT lifestyle of Londoners to attract them to come into clinic. The photo on the right is their Dean Street Express service. And this is a service where people can come in at a time of their convenience, do their own testing, which is processed on site, and they'll receive their results later that day. And again, you can see this doesn't look like a hospital at all. It's very modern, it's very trendy. It's really buying into kind of like the gay men's lifestyle in London and making sexual health something that's inviting, welcoming, and encourages people to want to get tests and make it really easy to do so. Dean Street have been sort of evolving over the past decade and constantly innovating themselves. And they've seen results from that. And their new HIV diagnosis in clinic have fallen by 80% since 2015. Part of that is also the work they've done around PrEP. Ahead of routine commissioning in England this year, we had the IMPACT trial, which was an implementation trial across the country. Dean Street had the highest allocation of places on the trial, but there was still greater demand than the capacity they could provide. So using generic treatment, they actually set up a PrEP shop, and they made it easier for MSM to purchase PrEP rather than buying online from overseas via online pharmacies. Since routine commissioning, this service has closed, but it was just one more way that men in London could access PrEP easily. Obviously, for those who are unable to fund PrEP themselves, this was a concern for Terence Higgins Trust. And in 2018, we set up the Mags Portman PrEP Access Fund. And this was for gay and bisexual men who tried to get on the trial, but had been unable to do so. And they had to be clinically eligible and financially. So they had to have no or low income, so were on welfare benefits or similar. Applicants were sent an SMS discount code, and they could then purchase PrEP for free via an online pharmacy. Of the applicants received in London, they made up 31% of the total. 77% of people who use the service hadn't accessed PrEP before. So we're reaching new people with these services as well by making it affordable. Another innovative project that THG worked on is our self-testing program. Obviously, these have become more popular around the world. We started to look at how we could reach more people. And originally, this program, which introduced a click and collect service, was aimed at increasing getting these kits to Black African men and women. But we also found that by adapting the service so that people could collect a test kit, not just from their home, was also reaching MSM. And on average, 9% of MSM were using this service, but we noticed noticeably higher rates within certain populations. So within people from Pakistani, Indian and Chinese backgrounds, there was a much greater uptake. And this was also seen in younger people as well. And it's largely thought this is to do with the fact that these people probably lived with families, and the fact that they were having sex with other men was probably not known and kept private. Just to finish off in what London's doing, just a talk about how partnerships work across the capital. And one of the longest standing ones is the GMI partnership, and HIV Prevention England, which is the programme that I work on, commissioned the partnership along with the Do It London campaign to provide outreach and community-based HIV testing across the capital. They're just one example of organisations doing this, but they really know how to work with the communities, and they basically reach people in the places they're living, working and socialising in. Each year that our programme also delivers National HIV Testing Week. This is usually in November. Unfortunately, because of COVID-19, we've had to push this back to February next year. But we really make the opportunity of reaching Londoners with outdoor advertising. So here we've got some examples of us advertising via the London Underground network. And we use people from the community in our adverts who have stories to tell. So on top of the the messaging around getting tested. We can adapt that with blog features, media articles, and that kind of thing that really target the community and make people more aware of the need to test. Looking ahead, obviously in the immediate future, we've still got issues in the UK relating to COVID-19. That presents some challenges and opportunities. HIV and sexual health services have changed drastically this year, being much more virtual, but we need to make sure that populations aren't left behind as services change in that way. We also need to look at how we engage wider healthcare providers going forward and increase HIV testing in non-traditional settings if we're going to find this small number, this 2,100 that are estimated to be living undiagnosed in London. Hopefully, we're confident that the implementation of the HIV Commission recommendations in England are going to help support this work. The HIV Commission is an independent process supported by THT, National AIDS Trust and the Elton John AIDS Foundation, and it's due to publish its recommendations on World AIDS Day, so in less than 2 weeks' time. They'll be published on the website where the address is there. It's worth visiting the website already. The Commission captured evidence from across the sector in England over the past couple of years. So there's a wealth of information already published there of ideas and programs of work of what people feel has been working and what needs to be done if we're to meet zero transmissions by 2030. So just to summarise, the HIV rates in London are continuing to fall and they're slightly ahead of the UK in regards to the targets. And this is definitely attributed to an evolution of the combination prevention approach. The fantastic surveillance data that we get from Public Health England is really helping us identify where and who we need to test. There's a broad sector in London and that's helping inspire innovation, but it's also supporting continuation of the jobs and the work that works and finds people. And there's still a job to do in terms of focusing on ending all transmissions by 2030. Thanks, and I'm happy to answer some questions.
Thank you, Alex. That was a tremendously rich presentation with enormous amounts of very recent data, and it gives us a lot of insight about how you've been working with all of your colleagues in the UK to get HIV infections down. I think it's really inspiring for us to see that, you know, it's possible to do that, to see that type of progress. So I've got some questions and including some that have been sent by people. So I wanted to just focus in on a number of things. So it seems as though there's been quite a lot of success in getting the HIV testing rate higher in London. And I just wondered if you could talk a little bit about how it's been possible to do that, and you know what have been the groups that have been very who haven't tested as much in the past, who maybe now are testing more. You know, are there particular testing interventions? You talked a little bit about this with ethnic minority populations, but what are the interventions that are working for different people?
Yeah, definitely. There's been a sort of like a combination of things that have worked in the UK. And I think one of the biggest things for us was self-testing. That was legalised in the UK in 2014 and the first kits became available in 2015. THT have done a number of pilots, initiatives in that space with that technology of reaching people, utilising social marketing campaigns, targeted advertising via platforms like Facebook, where we know we're speaking to the right populations, encouraging them to test. And the message has really been around testing is easy, it's quick, and you can do it within your own home, so you don't need to worry. And we've reached a lot of first-time testers through that capacity. I think what's also helped in the past 5 years especially is results from studies like Partner 2, Opposites Attract, and the U=U message. This has really removed a lot of the fear away from HIV, and that's encouraging people to test as well. People know now that the HIV doesn't necessarily have to be something to be afraid of if they find out they're positive. So rather than having a mindset of not wanting to know the result, they're now quite happy to find out.
So thank you. So you mentioned in your presentation about self-sampling as well, I think. So this method where people take their own samples and then they send them back for diagnosis work in a laboratory, which is a little bit different to self-testing, where people have a rapid test and they do it and they read the result themselves. So what part is self-sampling playing? And you know, is it particular people it works better for? Are there some advantages over self-testing?
Yeah, there's definitely some differences. We find that obviously people have different needs and different ideas about what they want from a test, and some people have less confidence in a self-test. So actually, by knowing that someone in a laboratory somewhere is processing the results, they feel that that result is somehow more accurate, even though we know that self-tests are accurate. So that's helps. It's also the way in which we distribute them. So particularly around National HIV Testing Week, we're usually helping Public Health England through that campaign distribute anywhere between 20 to 25,000 test kits to the target population, so MSM and Black African men and women mostly. And just being able to sometimes have a free test is useful as well. Particularly in the UK, migrants are able to access HIV and sexual health services for free, but there's a lot of misconceptions and misinformation about that. There's also fear about being in the health system. So being able to access a test in another way without visiting a clinic is also appealing to some groups as well.
Okay, so what about, so 56 Dean Street, it's quite astonishing the numbers on 56 Dean Street. So you said an 80% drop in new infections identified at 56 Dean Street since 2015. This is just quite astonishing in terms of the scale of what's happened. I think when lots of us working in HIV just hear this and just think, my goodness, how can that scale of things be possible? Can you tell us a little bit more about the models of work that Dean Street has been doing that you think have led to this type of drop?
They're really different to any other clinic in the UK, and they've created this brand, this 56 Dean Street brand that's not really seen elsewhere in the country, and it's made testing and sexual health sort of like popular. They're situated literally in the community, sort of like you walk 100 yards away and there's like gay bars and that kind of thing. So they're literally in the heart of the community. The express service is open so that when people are kind of falling out the nightclubs on a weekend, they can go into the service and get tested. So they're convenient, they're appealing, they really buy into kind of like the lifestyle of the LGBT community, as well as services for gay men. They have a weekly service for transgender and non-binary people as well, and that's very popular. So they've just constantly innovated, they've constantly looked at what they can do. They have a popular social media presence as well. And I even know people who travel from outside of London to use that clinic rather than one locally, because they want to, it's just appealing for them to say that, oh, I get tested at 56 Dean Street. It's built up a popularity, and it's, I don't know if it's something that would only work in London, but it's definitely something that everyone's always got their eye on.
We saw that one of the videos, I think, about Dean Street was talking about Dean Street Prime or something, where some people who are particularly high risk have a gold card and they get priority access or something. Could you?
Yeah, that's right. Yeah. So basically, the Prime service is a little bit. It's slightly like the prep shop was just an additional service that they created where they saw this need they could see in the clinic that there were certain men who were higher risk than others, and basically creating a dedicated service for them, and tailoring it to them, almost like a retailer would. Again, it's just something that's not seen elsewhere in the NHS, but it's something that they've looked to do. I definitely recommend, when we're all allowed to travel again, if you work in sexual health and you're ever visiting London, do contact the team. They're really accommodating in terms of showing people around the service and how it all works. I definitely recommend that if you're ever visiting London.
We'd love to. Thank you for the invitation. Somebody is wanting to ask, you mentioned that people from Pakistani and Indian backgrounds are using self-test more. Why do you think that is?
Yeah, so they're using the self-test more, but in particular the click and collect service, where they're collecting those test kits outside of their home address. And from our understanding, we believe this is likely because they're married or they live with their family, and the relationships they have with men are a secret or private. And therefore, rather than testing at home or being seen in a clinic, the fact they can pick up this test and then potentially, I don't know, do it in the bathroom at work or something, means they can still look after their sexual health, still test for HIV, but within that privacy. And that's the reasoning behind that. Yeah.
Can I ask you to just comment on some people watching are asking some questions about UVL. So somebody's saying, when on daily PrEP, will I get HIV if I have condomless sex with someone with HIV who has had undetectable viral load for a year?
So we know that anyone with an undetectable viral load on effective medication can't pass HIV on. And actually, even if you weren't taking PrEP, you'd be safe. We know it takes between sort of like 3 to 6 months on average for someone to achieve an undetectable viral load. But once they've got to that stage, all the evidence suggests that they're unable to pass the virus on. This has been proven now in a number of studies. I mentioned some of them before, so partner 2, opposites attract. And this is in anyone, so heterosexuals and gay and bisexual men. There's so much evidence now, and obviously it's fantastic that people can have sex without fear now.
Yeah, so someone's asking, is it that PrEP is free in the UK, and what is being done to promote it? I think you've talked a bit about this in your presentation already. So
PrEP is free, but in England specifically, it's only starting to be rolled out through our National Health Service at the moment. So some clinics are already offering it, others are slightly behind, and that's mainly because we've been impacted by COVID-19 restrictions. So we're in a much worse state on that front than you are in Hong Kong. We're in a second full lockdown at the moment, for example. We are at the moment, HIV Prevention England has been promoting PrEP to other communities where uptake is much lower. So of the data that we do have that's limited, we know that only 4% of people who were accessing PrEP through the IMPACT trial were non-MSM. So a really tiny number, and we're seeing that in the other nations of the UK as well, so in Wales and in Scotland. So we're trying to target and promote PrEP now through online campaigns, social marketing, to the other groups that could benefit from PrEP, but who aren't uptaking it at the moment.
Thank you. Well, I think we've come to the end of our time. So I wanted to say a really big thank you, Alex, for joining us today. We're sorry we can't have you here with us, maybe another time. But it's been fantastic to learn about the great work that you and so many people are doing. In Hong Kong, we say add oil, keep going. So you know, we really appreciate your time today. Thank you so much.
Thanks for the invitation.
Thank you.
Thanks.
Okay, well, we've come to the end of our conference today, so I'm going to say a big thank you to all of the speakers who've helped us to know far more about the local challenge of HIV, but also to look at what are the combination prevention options which we can work on together to try and reach 2030 with 0 new HIV infections. So a lot of work to do, but a very exciting time, I think, because there's a lot of possibility, as we can see from what we've just heard about in London, but also from what we can see is happening in other cities around the world. So this morning we heard from Dr. Bonnie Wong at the Department of Health about the current HIV situation. So she was saying that they estimate that there are probably 1,500 people with HIV in Hong Kong who have not yet been diagnosed. So this is part of the challenge and the opportunity for us to identify those people and to get them onto treatment. We also heard this morning about the work going on with PrEP pilot studies at the Chinese University of Hong Kong from Professor Grace Loy. So really interesting to see that PrEP is working for some Hong Kong people who are on the trials, and it's helping us to understand how we can roll out access to PrEP in the future. We also heard from Mr. Gambin Lee about the work AIDS Concern's been doing in the PrEP service at AIDS Concern, offering a medical checkup service to help people. Also this morning, we focused on HIV self-testing. So we saw from Dr. Alfred Sitt the results of the work that's been going on with a pilot of self-testing that's looking very promising. I think it's very notable that it was able to attract lots of people who have never tested before, which is a key target group that we need to work on. And then Ms. Charmaine Chan was talking about the progress on HIV self-testing that has been run by AIDS Concern. So this afternoon, we spent some time talking about social enterprise. So we heard from Mr. Tong Duan from Vietnam about the Lighthouse Social Enterprise Project, and also I talked about what AIDS Concern is doing as part of My Place. The other speaker we heard from today was Dr. Benny Huang from Taiwan, who explained the progress in getting infection numbers down in Taiwan and some of the great work they're doing on self-testing and PrEP there. We're really pleased to have Dr. Man Lung, who is known to so many people in Hong Kong, to talk about sexuality education and what we need to do to destigmatize it and make it part of the mainstream work that's going on. And we also had a conversation with Mr. James Chao about reflections on AIDS in the age of COVID-19 and all the work that's going on. A really inspiring and motivating talk from him, I think, about how we can feel good about the work that we're doing and we need to continue to do. So then we finished today by hearing from Mr. Alex Sparrowhawk in the UK about the incredible work going on in London in particular, where they've seen a huge drop in the number of new HIV infections among gay and bisexual men in particular, that I think gives us hope that we can do similar things in Hong Kong. So thank you again to all of those speakers. I'd like to thank all of the staff and the volunteers who've helped to put this conference together today. So I think it's a lot of work to put these things on and also to make it work in the new climate with virtual conferences. I want to again thank the sponsors, so GSK and Gilead and Janssen in particular. And I just want to mention a couple of items. There will be on the screen a QR code, which we'd like to ask you to use to do an evaluation for us of this event. This is really important for us to help us understand, did it work for you? Any suggestions about what you think could be improved or what you particularly liked? We're all getting used to these new formats, so please help us to understand and get feedback for future events. So please fill in the evaluation. We're coming up to World AIDS Day on the 1st of December, and there's a whole set of events that AIDS Concern, but also many other NGOs are working on for the community. We will have an HIV testing week from the 17th to the 23rd of December, which is open to all of the public, to come and get tested. So please help us promote that if you can. I think that's enough from me now. So all that is left for me to say, thank you very, very much for joining us. All of the presentations and recordings of the talks will actually be going online. So next week we will share the links to those. So anybody who hasn't been able to join for some of the presentations they would like to see will be able to see those. Okay, stay in touch. Thank you so much. Bye-bye.